I'm going to give it a couple minutes for folks to show up. It's 1 on the dot now, so. Okay, so now that I see all of the lead sponsors are here and our 2 panelists are here for the first panel, I'm going to go ahead and get this started. For the record, my name is Ricardo Arroyo. I'm the District 5 City Councilor. I'm the chair of the Boston City Council Committee on Public Health. I'm joined today by my colleagues, Councilor Braden, Councilor Janey, Councilor Bach, as well as Councilor Flaherty. This meeting is being recorded and live streamed at boston.gov City Council TV. It'll be rebroadcast on Comcast Channel 8, or CNN Channel 82, and Verizon Channel 1964. The Zoom link to provide public testimony for this hearing can be found by emailing Shane Pack, that's SHANE.pack @boston.gov. Affiliation, residence, and limit your, please state your name, your affiliation, residence, and limit your statements to 2 minutes to ensure that all comments and concerns can be heard. If you are unable to provide testimony today, you may submit written testimony or a 2-minute video for our record by emailing the committee at ccc.health@boston.gov or filling out the form on our website within 48 hours following this hearing. Today's hearing is on docket number 0747. It's an order for a hearing regarding the status of college and university plans to reopen for fall 2020 amid the COVID-19 pandemic. This is going to be a 4-panel hearing today. So the first panel is the City of Boston administration. We have Ms. Rita Nieves, the, is it still interim executive director of the Boston Public Health Commission, or are you the official?
Councilor. Yes, Councilor. Still interim.
Still interim, okay. And then Ms. Nupur, and please correct me if I'm pronouncing your name incorrectly, Ms. Nupur Monani, the senior institutional planner and project manager at the BPDA. Okay, fantastic, great. And so that's our first panel. Our second panel will be labor. And so that's Ms. Roxana Rivera, who's the director of SEIU 32BJ, Local 615. Mr. Jason Prentice, who's a member of SEIU Local 509 and senior lecturer at BU. And Mr. Jamie McNeil, who's the general agent at Unite Here Local 26. Followed by our third panel, which will be Northeastern University, and our fourth panel, which is Harvard and BU. And so we have a number of folks who signed up for public comment. What I'm going to do here for the interest of time is I'm going to let the counselors who are lead sponsors on this give opening statements. We'll then go by order of appearance into questions for the administration. I'm going to give the administration, before we go into questions, time to present. If you can keep that to about 5 minutes, and 5 minutes each. And then I'll open it up to questions. Somewhere in between there, I'll let folks come in for public comment, probably in the middle. So probably after panel 2, after labor, we'll bring in our public comment. And if anybody is added to the list late, I'll bring you in after panel 4, which is at the end. So with that, let me give this to Councilor Braden, who is an original co-sponsor, to give opening statement. Councilor Braden, the floor is yours.
Thank you, Chairman Arroyo, and thank you also to my co-sponsors, Madam President Ginny and Councillor Bach. Thank you also to all the panelists this afternoon who have taken time to talk with us. As you all know, the colleges are a huge part of our neighborhoods and an integral part of our local economy in Boston. And as we look forward to the return of students this fall, we wanted to meet with you and hear from the colleges and Labour and other interested parties to hear what the plans were for a safe and orderly return. There's much concern in the community about the return of students to our neighborhoods because not all students live on campus. So with that said, I want to keep it brief and I want to hear from the panelists and I look forward to your questions. Thank you.
Thank you, Councilor Braden. I believe there's also co-sponsor, City Council President Kim Janey. We've also been joined by Councilor Wu. The floor is yours, President.
So I want to start. Can you hear me okay?
Yes.
Yeah. All right, lovely. I want to start by thanking you, Chairman Arroyo. Certainly want to thank my sisters in service, Councilor Braden and Councilor Bach. This is a very important issue. I want to take time to thank the colleges and universities that are represented here today. I know that they have been dealing with COVID-19 like the rest of us. Certainly want to thank the unions that are represented, Local 26, SEIU 32BJ, Local 615 and 509, for all of their work, not just during COVID, but certainly throughout the year. People know that my district, District 7, so I'm the council president, but I also represent District 7. And District 7 is home to many colleges. We have Wentworth, we have Northeastern. And it's important that we are working with our colleges and universities to make sure that if students are returning, that they're able to do so safely. Certainly our colleges and universities have a big impact on our neighborhoods. You heard Councilor Braden already mention that, and the same is certainly true during this period of time as we are all trying to navigate COVID-19. So I don't want to go on and have too long of an opening. It sounds like with 4 panels, it's going to be a long hearing. And I will stay obviously as a co-sponsor for as long as I can. And I'd really like to just get into the conversation. So thank you again, Chairman Arroyo, and to my co-sponsors and to all of the panelists and anyone who is watching. Thank you.
We've also been joined by Councilor Flynn, Councilor O'Malley, so just to give you kind of a rundown on what's happening, we have the panel. The first panel is going to be the city administration. Second panel is going to be labor. The third panel is going to be Northeastern, followed by the fourth panel, which is Harvard and BU. So what I'm going to do here is the final co-sponsor is Councilor Bach. I'm going to give her the floor. If any counselor has to leave at any point, I just want to go in because of the amount of panels. I want to just go right into it. But if folks want to give a statement, if they have to leave, if they have a time constraint, if time's running out, raise your blue hand and I'll go right to you at that time. And so with that, Councilor Bach, the floor is yours.
Thank you, Mr. Chairman. And I also want to thank the administration for being here, the universities, our workers in every aspect of the universities, and my co-sponsors, Councilor Braden and President Janey. I too think we should just move right in here. I just want to say, I think that we have public meetings all the time in our work because the public business of the city, right, it shapes the conditions under which everybody lives in the city. And the reality is that ours is a city that is so dominated by large medical and educational institutions that there are substantial parts of our city, and I represent a lot of them in District 8, where our universities and our neighborhoods are totally intertwined. our entire workforce in certain parts is shaped by them. And so I just think it's really important that these conversations that I know all of our higher ed institutions have been having in their dean's offices, trying to weigh out a really impossible, difficult situation, that those conversations also be ones that we're having in public so that we can plan together, so that people can be safe, so that we can take the best possible care of our workers and our students and everybody involved in our university ecosystem. So I know that's really important to the people I represent, and it's important to me. And so I'm glad that we have a chance to have this conversation in July, even knowing how much is uncertain about where we will be in September. I think that for us to be having these open lines of communication help us avoid potential pitfalls, and also help us acknowledge that we're all going to need to come together to meet this really challenging moment and do it in the safest and most equitable way possible. So again, just want to thank everyone for participating, and thank you, Mr. Chairman.
And so we've also been joined by Councilor Mejia, and I'm just going to give you the quick update. We have 4 panels going, so I let the lead sponsors speak. If at any point anybody has to leave, please raise your blue hand and I'll let you take the floor wherever we are in testimony so that folks can have a say. Your presence is important, so are your thoughts. I see Councilor Flaherty has his hand raised, and so with that, I'm going to actually turn it to Councilor Flaherty for an opening.
Thank you, Mr. Chairman. Obviously, thank you to the lead sponsors, Councilor Braden, Councilor Bach, and Councilor Janey. And I'm going to be on and off, and I'll be obviously commit to reviewing the tape as well. We're home to over 100,000 college-age students, and as I've said it once, I've said it a million times, we boast of the best colleges and universities in the world. They add tremendous value to our city. They are some of our largest employers. They're almost like little cities unto themselves, some of them because of the size of them. But nonetheless, it is imperative that we have a clear idea as to what the policies and procedures are with respect to our higher education facilities. And, not only for student health, which is of paramount importance, but the health of the overall ecosystem of all those universities, the teachers and professors, the janitorial staff, those food service workers, even residential neighbors that use the facilities, businesses, students, their families, and obviously our campus police officers as well. So I'm looking forward to hearing the testimony from folks in attendance today. Hope to gain a deeper understanding of the plans that are underway to reopen our colleges and universities and get back to some semblance of normalcy, or at least identify what the new norm is going to be with respect to higher education and continue the tremendous value that they add. So, and also as a 10-year Teamster, Local 25, I love labor disputes probably better than anybody on our body, but I just want to make sure through the chair and obviously the lead sponsors that, we're going to be focused on the plan today and we don't go down road with collective bargaining stuff. And again, I'm happy to host a hearing on that front. But I just want to give a shout out to all those that are in attendance, to the value that they add to our city and particularly to our colleges and their campuses every day. And we're here to work with you. We want to make sure that we're taking every precaution necessary as we open up as a result of COVID, and that we learned yesterday with respect to our hotel workers unions and some of the things that some of the hotels are doing now, completely unacceptable. So we want to make sure best efforts are underway to make sure that our campuses and every facet of our campuses, students to employees are respected, but also make sure that the safety precautions and the sanitation and the cleanliness is there, so we don't have a repeat of what we just have gone through or still in the middle of. Thank you, Mr. Chairman, for the courtesy, and I'm going to stay on as long as I can, and I'll have to get off and get back on again. Thank you.
Thank you. And so with that, we're going to start with our first panel for the counselors. I'm going to let the panel present, and then we can go right into questions. If you've joined us and you're here for public comment, I'm going to allow public comment after panel 2. This is panel 1. And so with that, if we can go to Ms. Rita Nieves, the Executive Director at the Boston Public Health Commission.
Can you hear me okay?
Yep.
All right, great. Well, good afternoon, Chairman Arroyo, Councilor Braden, and distinguished committee members, and also other city councilors that are joining us today. Like the chairman just mentioned, my name is Rita Nieves. I'm the interim executive director at the Boston Public Health Commission. And I'd like to say thank you for convening this hearing in such an important topic in allowing me to share some thoughts on this issue. If colleges and universities reopen, they must do so safely and equitably. Just to be clear and remind folks on the hearing what the Boston Public Health Commission's role is. These institutions are regulated by the state, and we're waiting guidance, rules, and regulations from the state Department of Public Health that will guide some of the reopening decisions that universities and colleges would make. Chief Marty Martinez and I have been in close contact on the college and university reopening front, and we look forward to working with our city's colleges and universities as they consider their reopening plans. I'd like to start by discussing the public health challenges that lie before us, before highlighting some important considerations for reopening through a racial justice and health equities lens. You know, we all know that COVID-19 has had a profound impact on the city of Boston. As of July 7th, Boston has had 13,578 confirmed cases, with 9,568 recovered and 710 deaths among Boston residents. This pandemic has disproportionately impacted communities of color and other vulnerable populations within our city. As of July 1st, the rate of reported cases among Black residents is 278.9 per 10,000 residents. The rate among Latinx residents is 236.2 per 10,000, and compared this to the rate of reported cases among white residents, which is 95.8 per 10,000. As a commission and as a city, we are committed to addressing the racial injustices and health inequities that this pandemic has brought into sharp relief. Mayor Walsh's recent declaration of racism as a public health crisis is helping us to sharpen our focus and has given us some new resources and tools to further our work. Over the past 5 months, the actions that we have taken together have saved lives. The people of Boston have answered the call to stay home, wear a mask, wash hands, and practice distancing. We have had success in bending the curve and curbing case transmission. However, we cannot afford to become complacent. We need to continue our efforts to reduce the spread of the virus and to address spikes and clusters, especially as we look towards the fall and the potential for a second wave of contagion. Institutions of higher learning here in Boston will be an important partner in this fight. Higher education, as you know, has a massive footprint here in the city. The city is home to 31 colleges and universities. In 2019, over 138,000 students were enrolled in higher education in Boston. These institutions also employ over 35,000 people in payroll jobs, in addition to subcontractors and vendors. Balancing the risk involved with reopening is no easy task, but we know that our universities here in Boston are committed to the health of their students, employees, and the larger community, and will rise to this challenge. As we await state guidance, I did want to highlight a few considerations that are particularly relevant for institutions here in Boston. In the area of testing for COVID-19, well, we know that testing, tracing, and tracking are vital tools in our fight against the virus. We're looking to our colleges and universities to be proactive partners in these efforts. We know that many institutions are looking to set up systems so they can quickly spot any new cases. At a minimum, we would like to see user-friendly, low-barrier testing available so that students can be tested if they are symptomatic or have concerns, and also for those who are asymptomatic. A plan for testing a university community must be inclusive and equitable. So the plan should include not just the students and faculty, but also staff and other workers, including those not directly employed by the university, must be included. In the area of contact tracing, well, tracing is a resource-intensive effort. We know that firsthand as the department in the city that has been in charge of doing this work during the last 3 or 4 months. We have carried out contact tracing throughout the pandemic for Boston residents with some assistance from the state program, that they set up. We would like to give a special thank you to students from the BU School of Public Health who actually volunteered to be a part of this work. And this is a good example of collaborations and partnerships that we have, with some of our universities and would like to continue to have. So the BU School of Public Health students worked this spring as contact tracers with our Infectious Disease Bureau, reaching out by phone to hundreds of COVID-19 positive individuals. So looking ahead, in a phase of reopening, we anticipate the need to tight coordination with higher institutions on communications with positive cases and contacts. As the local Board of Health, the Commission holds the regulatory authority to do case investigations and contact tracing, while we anticipate that universities will undertake the case management and communication with their campus community. So this would be a partnership with shared responsibilities. We have experience in working with our local colleges and universities when addressing other kinds of infectious diseases. We're working to strengthen our communication channels so that whether a case is identified on campus or in the community, we can quickly mobilize our tracing system. It would also be important for institutions to maintain systems to document the occurrence of cases in their facilities so that any environmental or other issues that contribute to transmission can be addressed quickly. We've begun to develop protocols for this coordinated process, and we look forward to working closely with institutions as they develop their specific plans for reopening. In terms of facilities and the use of space, we encourage our colleges and universities to be thoughtful and creative as they approach the use of spaces on campus, particularly when it comes to large common areas that traditionally allow for people to gather in large numbers. We've been working alongside our colleagues in ISD and BPDA on de-densification of student residences. Not only is this important for curbing transmission, but it also makes intervening if there's a positive case more efficient, because if you're dealing with a smaller pool of people who may have been exposed, it's easier to intervene and address the situation as opposed to have to deal with a dorm, full of people who may have been exposed. And lastly, in terms of communications, we will be counting on robust, comprehensive communications campaigns from colleges and universities. We will need to have highly visible messaging around prevention and responsible behavior. Part of this messaging that we are hoping that our universities and colleges make sure that they have should underline that students are part of a larger community here in Boston and that they have a responsibility to that community. Colleges and universities don't exist in a bubble, as we know. So students, staff, and faculty live, work, and go about their lives across the city's neighborhoods. So it is part of the university's role to remind students of that interconnectedness that exists. And in closing, I'd like to thank the Committee of Public Health for having me here today to testify. We're looking forward to working with our city's colleges and universities as they consider the reopening plan. So happy to answer some questions from the committee when you want to start questions.
Thank you so much. And then I'm going to allow Nupur Manani from the BPDA. And then we'll go to questions.
Thank you, Chairman. Are you able to hear me?
Yes.
Great. Good afternoon, Chairman Arroyo and members of the council. My name is Nupur Monani, and I'm a senior institutional planner at the BPDA. Thank you to Councillors Braden, Janey, and Bach for sponsoring today's hearing. I'm testifying to share with you all the BPDA's policy to assist institutions wishing to de-densify their residential campuses in response to the risks posed by COVID-19. As we are all aware, institutions of higher education are working to ensure a safe and gradual return to campus life, and guidance has been issued by the state regarding limited activities in phases 1 and 2 of reopening. These institutions are required to submit COVID-19 control plans at each phase of reopening, which include measures related to social distancing, hygiene protocols, staffing and operations, as well as cleaning and disinfecting. As we approach phase 3, many institutions are looking ahead to resuming residential campus life, but in a limited capacity. They are preparing to do so with the health and safety of their communities and the city at large in mind, and as Director Nieves stated, with fewer students housed in dormitories. In order to compensate for this de-densification, a number of these institutions have approached the BPDA with requests to consider temporary approvals of off-campus housing. As a result, my colleagues and I, along with several key departments in the city, have outlined a process to facilitate the institutions in meeting this objective. I will now provide a brief overview of this process. In order for requests outside of an institutional master plan, an IMP, to be considered, the colleges or universities must submit an application to the BPDA detailing their COVID-19 safety strategies and proposals for additional offsite housing. The application will require that the institution provide details about how the properties will be managed. For example, whether there will be resident advisors on site, quarantine isolation measures, move-in, move-out procedures, and other information that will allow city agencies to ensure that these off-campus housing facilities are managed safely and operate with minimal impacts to their neighbors. The institutions will be required to engage with neighborhood civic associations and district councilors, both in the institutional area itself, but also in the proposed off-campus housing locations. And the BPDA may request that the institution take additional steps to mitigate any potential impacts if that becomes necessary. Following BPDA review and recommendation, the applicant will then file a request with the Inspectional Services Department for a temporary change of use. ISD will perform an inspection of off-campus facilities that are being proposed to be used in this manner for the future institutional use. If ISD determines that the proposed facility is appropriate and meets life safety standards, they will grant a 6-month temporary certificate of inspection. If the institution wishes to extend this use of off-campus facilities for housing into the following semester, which is spring 2021, the institution must file for a renewal, which will be subject to ISD, BPDA, and community review once again. If the off-campus facility holds a license, which is issued by the licensing board, they will also be required to submit a written notification outlining safety, security, and operations plans. The board would then administratively approve of a temporary conversion of the licensed premise to a dormitory use. Now, a number of these off-campus locations will likely be hotels. Like many sectors of our economy, Boston hotels have been hard hit by the COVID-19 pandemic. In April and May, hotel occupancy was limited by government regulations to essential workers. Boston hotel occupancy fell to 5%, compared to close to 90% at the same time in 2019. In June, Massachusetts entered phase 2, which allowed general hotel occupancy. And although the June occupancy rate is not yet available, it is likely that reductions in business and travel will keep hotel occupancy very low for the foreseeable future. Allowing some Boston hotels to operate as dorms for 20 and 21 school year will permit these hotels to utilize their properties to generate revenue while helping colleges to safely bring back their students to Boston. Housing 1,000 students in hotels who would not otherwise be able to return to Boston would create or maintain over 100 jobs and generate $12.5 million in additional economic activity and while doing so, support the struggling hotel industry. In closing, I would like to say that an announcement outlining this policy and the application process is available on the BPDA website. The BPDA will begin accepting applications on Monday, July 13th. All applications will be made public and will be posted on the website to ensure clarity and transparency throughout the process. Thank you to the councilors again for convening this hearing. I'm happy to take any questions and look forward to hearing from the other panelists.
Thank you so much. And with that, I'm gonna go to questions. I'm gonna have a timer on. I'll have mine on unmute so you can actually hear it when it goes off. I'm gonna set that timer for 7 minutes. Because we have 4 panels, this being the first, I am gonna try to keep us to that 7 minutes. If you can get it done in 5, there's no reward that I can give you, but you'll get a thumbs up because I'll appreciate it. And so with that, I'm gonna go to Councilor Braden. On deck is President Janey, followed by Councilor Bach. And I just wanna also recognize Councilor Asabi George has joined us. And so with that, that's the order. I'll save my questions for the end. If you don't have questions, feel free to kick it to the next person. But Councilor Braden.
I'm sorry, Councilor Arroyo. I'm not sure if anyone can hear or see me, but I'm here. I've been here, but I don't know. Can
Can you hear me now? I did recognize you when you got here.
I was having some technical issues.
Okay, so
here, so I'll be the last to ask questions.
Yeah, but well, no, Councilor Asabi George, and then I will be the last to ask questions. But
I'm saying,
yeah, we'll get to you. But I appreciate you being here. Thank you. So Councilor Mejia is with us as well. Councilor Braden, the floor is yours.
Thank you. Thank you so much for your presentation. I just had a quick question about the number of institutions that have been working with the Public Health Commission and with the BPDA in developing some plans. I know the application process for a certification for off-campus housing begins on the 13th, but in the interim, what sort of working has been happening with the various colleges in the meantime?
Thank you, Councilor Braden. We, as you just alluded to, the official application process begins on Monday next week. So we haven't received plans to the level of detail that I spoke to in my presentation. However, we have been in contact with a number of different institutions. I would say there's about 5 or 6 who have actively approached us in the last few weeks with just broad brushstrokes plans of what they're considering going into the fall. So we've had a number of informal conversations, but at this time, I don't have a greater level of detail to share with you on any one of these.
Thank you. That's all for me now. Thank you.
Thank you, Councilor Braden. Gold stars all around. President Janey, the floor is yours.
Thank you. Can you hear me okay?
Yes.
Thank you. I think for this panel, I'd be really interested. I heard the last panelist talk about a process from BPDA in which universities could apply for some off-campus housing. Is that what I understood? Could you talk us through where we are in that? Like how many have applied? Where is the housing that they could potentially put students in?
Yeah, absolutely, Councilor Janey. I'm happy to speak a little bit to that. So officially, the applications, we'll begin to receive them starting next Monday. And we haven't yet seen anything formal filed by these institutions. However, a number of them have been in conversations with us over the last couple of weeks. A majority of the locations that are being considered for off-campus housing happen to be hotels, and they are scattered throughout the city. Many of them in proximity with the large institutions in our neighborhoods. I think there are 1 or 2 sort of other off-campus locations, private residential developments that are being considered for this process as well. But at this time, none of these plans are firm yet. And I think we'll begin to learn a lot more starting Monday as these formal applications come in.
Right, and I know we have the hotel workers represented chair. I'm not sure if we have actual hotels. I think that is probably the win-win. If we have hotels that don't have guests because guests are not traveling, can they still stay in business by accommodating students from the universities. What I worry about is that this exacerbates an existing problem. Certainly in my district, I can't imagine that Councilors Bach and Braden don't also have this concern of students who are then taking up the housing that we know we need for residents of our city. And I know with certainly the universities in my district, because there aren't a lot of dorms. I know Northeastern is starting to build dorms now, but you know, there's this ongoing tension between residents and students, and we want to have, you know, neighborhoods where we can embrace everyone, but we don't want a problem that already exists to be exacerbated because we can't accommodate students in the hotels, and then they're spilling out, competing with families for limited housing, et cetera. So I would be interested in, you know, figuring out how we get the hotel owners and operators as part of this conversation, because they're an important piece to this puzzle, because that is the win-win. They are in a situation where they need some support and help because they don't have the guests staying. Colleges and universities need extra space so that we're not crowding in dorm rooms. And so that is the best option that I've heard thus far, but I worry that this is going to spill over into our neighborhoods. And so I'd be interested in what safeguards BPDA or any others in the administration are putting into place to make sure that the latter does not happen.
Thank you, Councillor. I think that's a really excellent question, and it's one that we have been sort of internally having a lot of discussions around. Again, at this point, because the exact plans are not entirely apparent to us, and we'll learn more during the course of next week, it's hard for me to estimate the number of institutions that will be looking at off-campus spaces that are not hotels. I can certainly work with Neil in the coming week as these applications come in and sort of loop back with you and sort of address it more specifically when we know for sure what's happening.
That would be great. And the last thing for me is just on the health side, because that's the other big impact, how we bring students back and ensure their safety. And so if there's guidance that's coming from the city, I'd be interested in that. And that's probably for Director Nieves, but that's my final question on this round, Council Chair Arroyo. Thank you. And thank you so much.
Thank you.
So, you know, the guidance will be coming from the state. So
Yep.
Waiting for that. And obviously when they come out, we'll look at them and provide any support that we need to the colleges as we help them, you know, interpret the guidance and implement them safely.
So following President Janey, we have Councillor Bach, Councillor Flaherty, and then Councillor Wu. Councillor Bach, the floor is yours.
Thank you, Mr. Chairman. My first question is really around the contact tracing and containment. Rita, you spoke about the sort of making sure that we would be able to contain outbreaks most efficiently in terms of the dormitories that people are staying in and de-densifying that housing, which is so important. And I'm glad to hear about the efforts on the BPDA side. I wonder how much conversation the Health Commission has had in terms of modeling just what it looks like for the city overall to have so many people come back to the city from all over in September. So it's a different issue, right? It's that initial moment of folks coming back, separate from what might break out subsequently. Because I know, I mean, it's a particular feature of our city, right? That our population swings so dramatically from summer into that fall moment. And I know that to some degree, none of us know exactly how much of that will be the case this year, because as our institutions decide how much they're teaching online, that may affect student decisions. But I think we do expect lots of students to maybe still be in place, even if they're not taking those classes in person. And so I know that that's a big concern. I represent the Fenway, Mission Hill, places with a lot of students living off campus. And especially as we sort of see troubling signs in terms of the trends and cases in other states of the country, there's a lot of concern about what happens and how we contain that epidemiologically. So I would love to hear if you could speak a little bit about what the Health Commission is doing to get ahead of that issue.
So, you know, that's an excellent point, and absolutely right. You're absolutely right. This is students coming back in town. It's a very significant event, and as you say, you know, it's a big influx of people coming all at once, different from tourism or, other visitors. So I think, that our key, the key elements that we need to make sure are in place have to do with monitoring and surveillance, making sure that, we're keeping a close eye on what our numbers are saying, before, students come back, if they come back, and then while they're here, especially, those first couple of months that students tend to do a lot of sightseeing in our city, right? And going out and stuff. And then the second element that is quite important, and it was part of my remarks, it has to do with making sure universities have testing systems in place, because one of the things that will be key for us is for universities to be able to test students when they come in, so we can have some sense of baseline and then have systems in place for ongoing testing, because that's going to give us a sense of what's going on and what are the numbers we're looking at, and be able to intervene quickly. So I think, again, monitoring and making sure we have that testing is available, it's user-friendly, and very easy for the students to access, both voluntarily for those that are symptomatic or asymptomatic, and also as part of a testing system that group of universities can set up, so they can do surveillance of their population on an ongoing basis. And if they're doing that, they're helping us get a really good picture of what's going on with that population.
Great. Yeah, I think that's so important. And I would just stress having, I teach at a university part-time, and being familiar with the rhythms, I would just say that I think it's often pretty standard for kind of, the semester starts and some people arrive early and there's certain programs that aren't up, and some institutions within a university are launching 3 weeks after the official start date. And there's often a kind of like ramp up period, just in terms of systems. And the thing I would worry about is that we would not have these things in place, the things that we're going to need to test, to contain, to contact trace, that like those systems would still be kind of getting set up while we had students coming back, just based on my own experience of university culture. And so I just think that we just need to do everything to make sure, to recognize that one of the moments of greatest danger for the city, public health wise, is the moment of influx. It's not just how people are going to live in these institutions over the following months. And so I would really, really want to underscore that point, and also underscore that, as the Public Health Commission asks questions, following on the state's guidance, that there really also be a focus on existing off-campus housing and what the protocols and expectations are going to be there. Because if we're de-densifying the dorms, but then all the folks who live off campus are still crowded, I've got a hillside on Mission Hill is just building after building with apartment after apartment containing 5 university students, right? I mean, it is a de facto dorm, except without the supervision and sort of official university responsibility that we would see in these other cases. And I also worry, I know that universities are in a difficult financial position right now, but I could foresee a situation where universities are charging more money for these de-densified dorms because they've got more space to handle and they've got to add all this protocols. And then people, meanwhile, see a oversaturated September 1st private lease market, and that becomes a lot cheaper. And suddenly we've got most of this public health problem outside of what the sort of universities consider their area of responsibility. And so I just think the off-campus housing issue can't be stressed enough. And we just really need to ask our universities to take the responsibility around their whole student population on that front. So just really want to stress that. Mr. Chairman, I imagine I've mostly run my time out. Is that true?
You got about 40 seconds.
Oh, okay. All right. Well, I'll just say then that to Nipur that I would love to also follow up in the coming weeks as we kind of get those applications in. Obviously, I represent an enormous number of institutions from BU to and parts of Northeastern and Wentworth, and also the colleges, the Fenway, Fisher. I mean, there's just the list goes on, and I'm very interested in how how we do this as safely as possible throughout our neighborhoods. So thanks so much, Mr. Chair.
Certainly,
you.
Councillor. I look forward to working with you on that issue going forward.
Councillor Flaherty.
Thank you, Mr. Chair. Obviously, to our public health folks and to the administration, just was curious. I know that we got the CDC guidelines, but what, if anything, is the city doing to require folks in the city to adhere to, tier 3 cleaning standards and/or take advantage of some of the new technology out there, like the microbe care, which is the mist that can kill bacteria for up to 1 year. So I just want to know, what role are we playing as a city? What proactive role are we playing to require entities, whether they're public facilities, I'm thinking about obviously our community centers, our daycare centers, but also our colleges, universities, making sure that they're doing the best on the cleaning side of the house as part of the plan, and more importantly, what products are they using to make sure that best efforts are being undertaken to sanitize and to clean, and if it's sort of the old day sort of fantastic and Windex, not going to cut the mustard with COVID, and we're going to need a tier 3, probably a hospital grade quaternary disinfectant, and/or what we're hearing now, sort of the latest advance in technology is this microbe care. So I guess, what position does the city and public health have with respect to that?
Councillor, thank you for your question. So we have, I'm sure you've heard, we have a number of teams that are looking at reopening plans for that are industry specific from different industry agencies out there, and we also have a number of teams working on developing guidance for the different industries. We have, from public health, we have people represented in some of those committees. We have folks from our environmental health department, and also it's obviously a key member of some of those committees. So, those guidances include, at a minimum, infection control, from cleaning to other measures that we're expecting different industries, depending on who they are and what they do. I don't have the details as to the cleaning products and protocols and methods specifically that they're advising industries. We also have a consulting group who's helping on this industry specific guidance, and also reviewing plans with industries and offering advice. So I don't know if no, you probably don't have any from BPDA, but I'm sure they're looking at everything that has come out, and really making sure that we're offering whatever is the best evidence out there in terms of products to use. They're incorporating that in the guidance. So
Thank you. I think we're going to need to dial in on that. There's lots of cleaning companies out there from A to Z, but not all of them are tier 3 certified, and not all of them have the necessary certifications around the sort of quaternary disinfectant, that hospital grade disinfectant, and/or have access to and/or capabilities to use the microbe. So that's where we're going. That's where we're going to need to be. And so I think we obviously, as a city, and I know that our institutions are listening, and beyond that, we really need to give a lot of thought to how we're cleaning our buildings and our facilities, and who's doing that cleaning. Are they certified? And what materials are they using? What cleaning materials and supplies are they using? That's going to make the difference. If we're just sort of saying, oh, we have a cleaning company and they're cleaning and they're just going old school, old fashioned, that's not going to cut the mustard moving forward. And that has to be part of this discussion from a public health and a public safety perspective. And so each one of these institutions and/or even the city, we could probably list all the cleaning companies that are cleaning our schools and our community centers and beyond. We now have to dial in a little bit closer and say, well, who are they? What are their certification levels? Are they tier 3? What materials are they using? And how effective are those solutions? And we may find that it's not enough. And if we're going to start to reopen, and if people, if daycares are going to be open, and community centers are going to be open, and camps and all of that stuff, if that's all going to start now coming back online, we need to dial in as a city and as a public health department to exactly who's cleaning, what are their certification levels, and what materials are they using. I cannot emphasize that enough. And hopefully I'll hear something from folks today on that issue, because at the end of the day, the plan to open up, it's all about, is it safe? Is it going to be clean and sanitized? So we're going to be talking about cleaning and sanitation. We need to get in the weeds here on that. Thank you, Mr. Chairman.
Thank you. Councillor Wu, followed by Councillor O'Malley, followed by Councillor Flynn.
Thank you, Mr.
Councillor Wu,
Chair.
the floor is yours.
I am going to say I'm sorry, I'm going to have to duck out for part of the hearing, and then I'm going to try to come back on afterwards. So really grateful to the administration reps who just spoke and for all that you're doing. Can you just outline again a little bit, sort of what legally, what authority does the city have to proactively set requirements for some of these public health or other protocols towards universities?
As far as the reopening guidance, the state are the ones that regulate and license these institutions. So we don't have, in terms of the public health guidance, it is the state who has the authority to tell them how they should reopen and what reopening should look like from the safety and public health perspective. I know ISD and BPDA have some authority, in terms of, the facilities and the occupancy and all the other stuff that those two departments do. But as far as the public health, it is the states who oversees these facilities.
So for example, if there are universities who are planning on, at some point we hear one of them is going to come back with everyone on campus and not a lot of changes, could the city go in and say, we're going to pass an ordinance or take some action outside of an ordinance to require 50% capacity at dormitories, or whatever is there that kind of authority?
Yeah, we would probably have to work through the state. They would have to follow whatever the state puts out, and hopefully, assuming that we're 100% right in agreement with everything that the guidance says. If we have any concerns or any problems with how an university is approaching a reopening, we would work with the state to make sure that they can exercise the authority that they have to make sure that things get adjusted. And we would use our relationship. We have a relationship with these universities. We work with them for many different reasons. And so we're partners, we're collaborators, and if we have any concerns about anything, we'll pick up the phone as well. But we'll use
okay. That makes a lot of sense. Thank you. And so I'm so sorry. This is probably very basic, and there's so much news flying around, so I've been following so closely. Has the state issued, what level of detail of guidance has the state issued towards universities?
No, but it's coming. It's coming. We're expecting to come fairly soon, because obviously, it's already July 9.
Okay, so has the city been involved in those conversations and setting that, and it's just a matter of it's not public yet, but what's going to come?
No, we have not been involved in those conversations. No.
Okay, I mean, it's just a little scary because I haven't been, just as an individual, very comforted or impressed by the state's pace or sort of acknowledgement of how serious the safety and public health conditions are. So I'll be interested to see what window there is for the city to have feedback. I mean, it's kind of surprising and disappointing of the state that the city hasn't been consulted or invited to directly participate. I would have hoped that they would have asked our public health leadership here to directly be involved. And so, again, that's not on you. That's more to add to my list directed at that level of government. But say the requirements come out soon, or the protocols come out soon from the state, and we disagree. What is the plan then?
So let me just add something, formally, we haven't been sitting at the table drafting these recommendations with the state, but, a number of folks from city government have informal conversations with our state partners and our counterparts around these issues and many others around reopening and sectors and different things. So, we, there are conversations happening, but formally we were not sitting at the table that is drafting the plan, is what I meant, okay?
Okay. Okay. I think it's just, again, this is not directed at you all. I think there's been a lack of transparency in general in terms of the state's process and the movement between phases. And it's just very frustrating to hear that we don't have a seat at the table, that we haven't been asked to directly draft the regulations, and that there's sort of a, informal channels and back and forth, but ultimately, we are home to the universities. We're going to deal with the consequences first and foremost if things don't go the best way that they could. And so, I would just push for Boston to be more proactive in demanding that those seats at the table too. But thank you for your leadership and your time with us today. Thank you, Mr. Chair.
Thank you, Councilor Wu. Councilor O'Malley.
Thank you, Mr. Chair. No questions at this time, but I will for the next round. Thank you.
Thank you, Councilor Flynn.
Thank you, Mr. Chairman, and thank you to the administration staff that is here with us today. Thank you, Rita, for your presentation. It was helpful. I wanted to.
We lost you there, Councilor Flynn.
Yeah, I wanted to first. Okay, I first wanted to say that was good news that Boston University is working with the city on ongoing tracking testing. So maybe they might be able to provide a little bit of background on that. I was impressed hearing that information. And then the other comment I wanted to make was, I just hope that people that are working in cleaning buildings or associated with any type of cleaning, that they're highly trained, they're highly skilled, and they receive a good wage and safe working conditions and in healthcare as well. I just want to make sure that anyone that is working in this environment has the training, the education, and the skills to do the job, but also they're getting paid a decent wage. They also have access to healthcare as well. So is that something you are looking at as well, Rita?
Not at this moment, but we could definitely add it to the list of things that we can discuss with the universities as we connect with them, around reopening.
Yeah, thank you. I think that's important for us to at least ask the question, because we want to make sure that anyone that is working in this field does receive a good wage, good health care, access to health care, family wage. So I just wanted to follow up on that after. And I have other questions, Mr. Chairman, but I'll wait to the next round. Thank you.
To be clear, you mean the next round with the next panel or the next round?
No, the next panel. I'm sorry.
Okay, no worries.
Panel. Okay.
Councilor Mejia, followed by Councilor Asabi George.
Okay, thank you.
Councilor.
Councilor Arroyo, thank you. Can you hear me?
Yep, you're coming through clear.
Perfect. So I just wanted to thank the makers and you, Chairman Arroyo, for hosting this. I just have two questions, believe it or not. The first one is for Ms. Nieves. You mentioned the need for an equitable testing process. Can you go into more detail about what "quote unquote" equitable testing process looks like to you? What does that mean?
So the point that we were making is that, because a university and a college is a community, that's comprised of different folks, right? Not only the students and the faculty, but the staff that works there, vendors, people that come in and out of that community. So, as universities think about making testing accessible and available for folks, we want to make sure that they're available for everybody in that community, so they don't forget any of those folks. That especially, there may be folks that work for a vendor that they don't have access to good health insurance, or they don't have opportunity to go get tested because they work 2 jobs. So if the university has a comprehensive testing system that makes it accessible and available to all, everybody can have equal access to test.
And that also would include like making sure that people can afford it, the covering the cost. Because when I think about equitable,
right, absolutely.
I think about making sure that you can do it. It's good for it to be in theory, but kind of really looking at how they're going to make it accessible, like in terms of fee.
Absolutely. Absolutely. It would have to be, free of charge for folks, especially those that cannot afford it or don't have insurance. So, yeah.
That's great. And is that something that you are willing to, that you would be asking them to make a commitment to as part of their reopening plan? Are you going to, how are we going to monitor whether or not they actually are doing it? Are you thinking, have you given it that any thought?
Well, when we connect, we're waiting for the state guidance to come out so we can look at them, make sure that everything that we think is important is covered. So we intend to connect with the institutions so then we can have conversations about how they're going to approach and roll things out. And again, even though we don't have authority as a partner, because we're this together and they're in our city, and we already have relationships with this institution, so we will ask all those questions and make all those obviously suggestions and recommendations.
Thank you. One last follow-up before I go to the BPDA questions that I have. I'm just curious in terms of your thought process. Have you gotten any feedback or input from college students? Have you engaged the folks who are working in these universities? I know my mom is a food handler, so she works at a university, and so no one's really called her to ask her what she thinks, and just curious as to whether or not you have given that any thought in terms of creating space for those who are living the realities and doing the work to inform your thinking.
Yeah, that's a great point. We haven't reached out. No, we haven't done any formal reach out yet to folks like that. We haven't done it with universities yet either. But it's a great point. I think we haven't had, as far as I know, we haven't gotten any emails or calls or comments from folks like that, with concerns, but I'm sure that'll happen at some point.
And all of those things exist because we've gotten calls from students. In my own personal experience, my mom being a food handler, I've gotten some questions from her, like in terms of what this is going to look like. So those people are out there. I just think that it would be a great practice just to get into figuring out, even having a focus group. So, but thank you. And I'm looking forward to working with you this year. I love the Boston Public Health Commission. I love a lot of the programs that you have, especially the Boston Youth Development Network. So anyways.
Looking forward to it. Yes, we need to reschedule our meetings. Yes.
We need to make that happen. So I'm moving on to my BPDA questions. Just curious if you could talk to me a little bit about what standards are in place for the new off-campus housing. I'm thinking about room occupancy, cleanliness standards, facilities for such as food being taken into account. Just curious about what this looks like, if you can provide me some input.
Thanks, Councilor Mejia. That is a really excellent question. I, at this point, don't have the necessary background to speak to that. My role in this process has been largely focused on helping the institutions de-densify their existing dorms and sort of thinking about how hotels fit into the process as part of that equation. I would be very happy to sort of work with Neil, take this question back to others on our team and connect with you in the coming week to talk more specifically about that.
Yeah, that would be extremely helpful. And then this is probably, and you can shut me down any minute because I might bring you down some rabbit hole that you have absolutely no business going into, but I'm just curious as we start thinking about this, and I think about the housing crunch that exists, and I think Council President Janie had mentioned in terms of like the displacement of our people who are already here when we have all these students coming back into the neighborhoods. I'm just, if I can just tweak that a little bit more, just kind of curious what parameters and what things are you putting in place to ensure that we don't experience displacement here?
That's another really great question, Councillor, and it certainly applies to the situation that we're in now, but it's one that we continue to think about sort of long term for the city as well. So again, happy to sort of talk more offline. However, at this point, unfortunately, I don't have a ton of detail to share with you on it.
Yeah, I'd love to be a part of that conversation whenever there is a need for us to participate. I'm very curious about that, and there are a lot of folks who are already experiencing the housing crunch, and this is making it worse. So, but thank you both for your answers. Councilor Arroyo, I yield the rest of my time.
Thank you. The timer just went off, so that was perfect time. Councilor Asabi George, followed by Councilor Edwards, followed by me, and I'm just gonna. Northeastern is going to actually get moved in time. They've reached out that they have to leave relatively shortly, actually. So we're gonna, if labor can just wait a little bit while we get them out of the chain, I want to make sure we get them in and heard. But Councilor Sabi George, followed by Councilor Edwards, and then I'll ask my questions, and we'll go to the next panel.
Thank you, Mr. Chair. Thank you all. And I actually am going to dip off, I think, with my at-large colleagues for the fireworks task force and then come back shortly. But a quick question. I know that the BPDA had, and thank you all for being here, the application for the BPDA's announcement for the application for the universities, that's supposed to be on the website. Can you just tell us or point to that on the website because we weren't able to find that? And then my second question for Director Nieves, the testing that we're looking to provide on university campuses, I think is an excellent opportunity. It's something that we need to be doing. Is there an opportunity to do, or maybe partner our universities with some of our public schools to make sure that our BPS kids have access and school staff have access to some of that testing as well?
That is an interesting idea, right? And I'm sure it would work for some schools that are nearby some of the universities. So we are in, and by the way, the testing, that we hope to see, is testing that the universities will have to provide. We're happy to provide consultation and provide TA, but as you can imagine, this is an enormous amount of resources and effort that will go into creating those systems in each university, which is quite different. And our resources and efforts our priority is to make sure that we continue to increase capacity for testing for our residents throughout all the neighborhoods. So, so as far as asking universities to help some of our BPS schools, it's something that I will be happy to bring to our BPS folks. We're always in conversations with them around similar issues, and because it would be interesting if they can approach some of the universities that are nearby and team up, because that's one of the conversations we've had with BPS. How can, if they open physically, the more we can make sure that there's accessible testing for kids that become symptomatic or adults in the building, the faster that we can identify cases and the faster we can identify contacts, intervene without having to disrupt a complete, a whole school. So, so we're having those conversations with BS, and I'll be happy to bring that up because it's an interesting thought that it could potentially, work in some areas of the city.
Well, I appreciate that. And I think with the med schools and, the universities with healthcare delivery programs, and I'd also just note the asymptomatic our young people and our school staff too across the district, but thank you for that. And then I don't know if we've got a response on the BPDA application question. Thank you.
Yes, thanks, Councillor. The application and the details to apply are available on the website under development, which is a tab sort of at the top of the page. And then if you scroll to institutional master plans, this is sort of the space on the website where a lot of our information related to the institutions lives.
That might be why it was hard for us to find it. Very good.
Yeah, we can try to have it featured more upfront on the website, so it's right there when you see it. I'll also be happy to share with you the link to the application after the meeting.
Great, thank you for that. And thank you, Mr. Chair, and to the makers of this hearing. I do have to, like I mentioned before, dip out for the task force, but I will come back for the later half of this hearing. Thank you all.
Thank you. Councillor Edwards. If you have any questions, the floor is yours.
Oh, can you hear me?
Yes.
So sorry. It's been back and forth. My apologies. And I also apologize for being late. So I'm going to apologize because I know a lot of you may have covered this. So I just have a general question, and that is about with the colleges and universities coming back, what is the standard for when they need to shut down again or when they need to separate or to have the students self-isolate? How are you going to monitor? Because the students are coming from all over the country where there are a lot of different issues with this pandemic where governors literally deny that it even exists. And so, you can't stop the universities from recruiting from, let's say, Florida or Texas or wherever the next pandemic is coming from. I don't know that you can necessarily target those kids either and just regularly check their temperature. But so they're here. So how do you monitor or prevent the outbreak from happening from any of the universities who are going to have kids on campus? Do you require them to report cases on a daily, weekly basis so we can see, oh, no, you guys are increasing too much, you guys got to shut down? What's the temperature? How are you guys going to monitor outbreak on campus?
So let me answer the question on testing that I mentioned at the beginning. So we're hoping that, many universities are having these conversations and trying to come up with systems that would allow them to have on-site testing available for their students. And, when we connect, after the guidelines are issued and we get a chance to connect with universities, one of the questions we're going to ask is, is your system going to ensure that you get a baseline from everybody when they come in? And then what's going to be the schedule of testing? I've heard different schedules being mentioned, from different places, but a system that they know, okay, we got 1,000 students back and this is our baseline, this is where they're at. And then creating a schedule in which they can then test folks in whatever schedule is affordable and is doable, will help us keep the pulse of the situation and see what's going on in the university. As far as, new cases, anytime a person is identified as being positive, it gets reported to us within 24 hours. So we know, sometimes we may even know before the university, if I'm student X and I go to my primary care outside the university and I get tested and I'm positive, that test gets reported to us and we'll likely know before the university. So it is our job and this is what we do. It's part of our functions. We will be, in that case, be the ones contacting the person, the student, and then contacting the university so we could do contact tracing and relying on them and partnering with them so we can then really have access to who else may have been exposed and then intervene. So that's just regular business for us. But in this particular situation we're in, where we may have a lot of people coming back more or less at the same time into the city from, like you said, not only different states, but different countries, it very important for us to get a baseline of, Charlie who came from Florida or Mary who came from California, when they arrive, what's their baseline, and then monitor the student and the community, the university community in general status, so the university can quickly identify whenever they have cases. And then if we ever end up with a cluster, that's part of our function, working with the university, doing contact tracing, helping them make decisions about what does that mean? Do we need to close down this building, as opposed to the school? Do we have to close down this dorm as opposed to, and when I say close down, I mean, put people in quarantine that may have been exposed. So that's what we do. And we'll do it in this case, we're working with a system that has an infrastructure, that has resources, and it'll be a partnership with us leading the process, and then, obviously working with us to effectively, respond. So there are systems in place to do all this. We just need to, in this unusual situation, is make sure that what would need to be new is, universities creating their ability to identify new cases and do it quickly, and then working with us so contact tracing can happen and the larger community can get protected.
Thank you. I think one of the things I'd love to figure out is how do you get folks to get tested, right? Because having testing facilities is different than telling the students you have to be tested. And maybe some universities could consider a policy that requires that. I mean, they require vaccinations, for example, or proof of vaccination. So maybe that they should consider some policies that require the proof that you got tested for COVID. Again, people are coming from all over the country. They do or don't believe this exists. They do or don't believe in science. And that's what we're dealing with. I am not concerned about, the good actors and people who want to come and be educated and follow the rules. It's the people who just don't, who we can't even get to wear masks here, So that's really, I'm hoping that we can figure out some sort of enforcement or at least requirement of that. And I appreciate your note that you have already discussed that with having a baseline. So thank you very much. That's all, Counselor.
Thank you, Counselor. And so I'm just going to ask one question, and then I'm going to move to the next panel. Director Nieves, I'm aware that the state is putting together their guidance and their guidelines, and the belief is that that'll come out on Monday.
I'm not sure if it's Monday. I don't have a particular date, but very soon.
If you were in the room on that, what guidance would you be saying needs to be top of mind? What guideline would you think should be top of mind?
So, what I mentioned in my remarks, testing, tracing, and really good surveillance and monitoring system is the key. Is the key for us to run the city and keep an eye on what's happening. And especially at the moment where we're at now, our cases have gone down. So, even more important for us to have a very robust surveillance system. So we immediately that we see an uptick can identify it and stay on top of it. So it's the same thing. If you think about the university as a larger system and a mini community or a mini city. So I would say that the key here, there are many things that are not in our control, but what's in our control is how do universities make sure they know who they're getting back? How do they make sure that they drive the message of prevention down, on a daily basis, so everybody understands what are the expectations on what's the new normal and how they need to behave, and then having a system in place to identify new infections, and immediately that they identify new cases, that they have quickly the ability, they're working with us so we can do contact tracing and make sure that then we mitigate exposure to other folks. The issue of densifying the is really important because it's about making sure that, similar to the schools, if we create systems in which we don't have 200 kids interacting in a cafeteria, rather we have 10 groups of 20 that they'll interact during the day. If there's a case going on in a classroom, in a particular school or university, we know that then it's easier for us to intervene with those 20. And even if we have to do drastic measures as, send them home or quarantine them, then it's easier to do that than to interact and intervene with a whole building or school or dorm. So I think those are the key elements that the things that are in our control, because there are things we don't control, but this we do. How to communicate, how to have great systems in place, and how to partner with us so we can do contact tracing and really quickly mitigate exposure once we have cases, because we'll have cases, but we can minimize, what happens when we do. And with de-densification, we will minimize the opportunities for clusters and large groups of people that get exposed and then go out there and then expose other folks.
And so I guess this is a question, it might be more legal focused. And so if you don't have the answer, then I understand that. But in terms of, so my biggest concern, one of my bigger concerns about reopening schools is twofold. One is that, we have temperature checks and things like that we tend to do in City Hall even, but there is an asymptomatic portion of the population to this disease. And I guess the question that I have is certain sports leagues and their reopening have created sort of mandatory testing on a specific timeline for everybody who's in that space. And the question I have is whether or not you would recommend mandatory testing, and whether or not whether or not it's legal to conduct mandatory testing. In other words, if a student came in with political views, we have masks somehow became political. If we have a student who says, I'm not gonna submit myself to testing, is it legal for that to be a mandated requirement for entry into a classroom or a school? Do you know whether or not that's a legal thing we can do? And would you recommend mandatory testing as opposed to just temperature checks?
I don't know. I'm sure there's some legal aspect to that question. I don't know the answer to it. And I'm sure, what the universities who are considering that have already checked with their legal teams and have arrived to an answer. In terms of, where I think it should be mandatory, I think, this is a very, unusual and surreal situation we're living in. And the thought of mandating, well, we do ask students to get vaccinated.
Yes, we do.
Cannot come in. So there is a history already, and all because we have to protect. It's not what's good for you, it's what's good for you and others if you're going to be interacting with a community. So following that same philosophy and approach, I think we all have a responsibility. If I want to come and be in a facility and interact with 1,000 people, we all should have some sort of sense of accountability and responsibility. And if we have to ask people to accept being tested every so often, I think it's reasonable given what's at stake. So that's what
Thank you so much. We're done with the first panel. So if the two of you can, if you want to stay, you're welcome to stay. Nobody's going to kick you out. But if you want to go and do other things, you can do other things now. Thank you so much for your time. I'm now going to introduce our second panel, and that is Northeastern has gotten moved up. And so I don't know what order in which you would like to present. And so I'm just going to introduce you all, and then whoever unmutes and goes is who's going first. But we have John Tobin, a former city councilor, but also the vice president of city and community affairs. Kathy Spiegelman, who's the VP and chief of campus planning and development, and David Luzzi or Luzzi, apologies for the last name, senior vice provost for research. And so in whatever order you would like to go, please feel free to go.
Thank you, Mr. Chair. I'll kick it off. For the record, my name is John Tobin. I'm vice president of city and community engagement for Northeastern University. It's a great pleasure to be before you and your colleagues today, Mr. Chairman. As you know, I had the great honor to serve with both your dad and your brother. I don't know if they call that having great experience or just getting old, but it's great to appear before you and your colleagues. And also to the maker of the order, Council Liz Breeden, City Council President Kim Janney, and City Councilor Kenzie Bach. I want to thank you for hosting today's event. We thank you for this opportunity to share more information on how Northeastern will reopen its classes and residence halls to faculty, staff, and students this fall. As Northeastern plans for reopening, our guiding principle is maintaining not just the health and well-being of the Northeastern University community, but also the health and well-being of the world beyond our campuses. In each step of our response, we have relied on public health recommendations, state and city guidance, and the latest scientific research. Here is a brief overview of the actions we are taking. We will use a hybrid, flexible learning model called NewFlex to reduce classroom density. Some students will be present in the classroom and others will participate remotely in real time. We have implemented new protocols to reduce the risk of transmission. This includes anyone returning to campus must complete a daily COVID-19 symptom screening. Face masks or cloth face coverings must be worn at all times, outdoors and inside all buildings. Each campus space, offices, break room, residence halls, common areas, and dining halls will be reconfigured to promote healthy distancing and the highest hygiene standards. A rigorous cleaning and sanitizing protocol follows all CDC guidelines using EPA registered and approved disinfectants. All students, faculty, and staff returning to campus will be required to undergo viral testing regularly. We are building the capacity to conduct 2,500 to 5,000 COVID-19 tests per day. Our goal is that returning staff and faculty in our Northeastern community feel comfortable doing so. A policy and procedure is in place for those who would like to request a continuation of remote work. We are prepared to provide insights about our plans and answer many of the questions that were sent to us. Some we cannot answer now because we are creating procedures that will get defined over the next few weeks. University leaders have been meeting each day to plan Northeastern's continued response to this global pandemic. I will now introduce two university leaders who have been closely involved throughout our planning, and then invite them to share their own remarks. As Vice President of Chief of Campus Planning, Kathy Spiegelman is responsible for the effective use of land and buildings across Northeastern's global network. As we reopen, Vice President Spiegelman is responsible for space planning. And as a Senior Vice Provost of Research at Northeastern University, David Luzzi has been closely involved in the continuity of our research enterprise and in the university's plans for COVID-19 testing. I'll now hand it off to Senior Vice Provost Luzzi.
Thank you, Vice President Tobin, and thank you to the Boston City Council for the opportunity to speak with you today. As Vice President Tobin just discussed, our guiding principle is maintaining the health and well-being of the Northeastern University community and also the health and well-being of the world beyond our campuses. We recognize that our students, faculty, and staff are interacting with the community beyond our campus every day, and protecting their health is protecting the health of the Boston community as well. To that end, all students, all faculty, and all staff returning to campus will be required to undergo viral testing on a regular basis. Northeastern is building the capacity, as President Tobin mentioned, to administer 2,500 to 5,000 tests per day, with the ability to go beyond that if necessary, using frontal nasal swabs. The technology behind this is state-of-the-art PCR, polymerase chain reaction, which is the gold standard for testing, and the same technology used to sequence the human genome. Baseline testing will be available at the beginning of the fall, and symptomatic testing will be available throughout the term, and routine testing will be conducted as well. This testing is already underway, and Northeastern welcomed a small number of returning students into our residence halls last week and has required them to undergo COVID-19 viral testing. Returning faculty, staff, and researchers have undergone testing as well. If a member of the Northeastern community in Boston tests positive for COVID-19, we have an established internal contact tracing team trained through Johns Hopkins that will provide contact tracing for our residential population in cooperation with the Massachusetts Department of Public Health and the Boston Public Health Commission. Contact tracers will personally reach out and act as caseworkers for anyone who receives a positive diagnosis, helping the person to understand next steps and to access care. They will identify close contacts of anyone who has received a positive COVID-19 test and help close contacts take next steps for their own safety and the safety of the community. Thank you for your time. I'm happy to answer further questions. And after Vice President and Chief of Campus Planning, Kathy Spiegelman, presents her remarks.
Thank you, David Luzzi, and thank you, Boston City Council, for inviting us to come talk about the plans that we've been engaged in developing over the past several months. And I'm glad that David Luzzi went first, because listening to the questions that have been asked, I think all of the work that we've been doing about testing and tracing. And I will add masks to that because I think our bottom line is testing and tracing and everybody wearing masks. In addition to that, a lot of the other things that have been addressed here are ones that we've been working on. So I'm hoping that we will be in sync with all of the other members of the Boston community that we understand we are a part of. We are working to reduce density. As Vice President Tobin suggested, we have our hybrid teaching model is going to reduce the density in our classrooms and have students stagger through so that we're keeping track of right now what we're calculating, which is the 6-foot healthy distancing with students wearing masks and with some students being in the classes virtually and some people being in the classroom on a staggered basis. We also have a comprehensive signage plan to be reminding everybody about wearing masks, about healthy distancing, and about respect for the members of our Northeastern community and the community of Boston in which we exist. We have a comprehensive website and we're very focused on communication and a communication plan to keep re-emphasizing the messages as time goes by in the semester. Some of the things that have come up so far here in your meeting, the protocols for cleaning are very well established. Yes, we are using EPA approved materials. We're following CDC guidelines, and we're also cleaning all of the common spaces, classrooms, common spaces, all the shared spaces in the dormitories on a more frequent basis than we would have otherwise been doing. In our residences, we are getting rid of, we are eliminating triples, we are eliminating quads, we are having singles and doubles only. And because that reduces the amount of housing that we can offer students on campus, we have been working with a couple of hotels, and we've also been working in properties that we have for several years been leasing master lease apartments in the neighborhood around the campus. And I'm happy to talk more about that as we file the application with the city, which we just learned about today. If we have in our dorms, there will be mask wearing when students are not in their private rooms. There will be protocols for shared bathrooms. There will be proctors who are regulating who gets into the building, and there will be a policy of no visitors. If in fact students do test positive or develop symptoms, we are holding over 500 beds in an area of the campus that we will use for necessary quarantining. In the common spaces, we will have capacity limitations on elevators. We will have signage for one way in, one way out in buildings and spaces where that's appropriate. And we'll be reconfiguring furniture so that we don't expect students to hide in their rooms, but we expect them when they're out and around the campus to be respecting the healthy distancing that we're establishing. As Vice President Tobin suggested, there's a group of leadership at the university that has been meeting on a daily basis for months now. We are seriously guided by the science. And I think that's a place where working with your Public Health Commission and working with all of you together as we go forward will be a place that we can actually come together and help each other. So we look forward to that. And thank you for inviting us to speak with you today.
Thank you for that. I'm going to jump right into questions. Councilor Braden, followed by by President Janey, followed by Councilor Bach.
I'm just curious about your de-densifying your dorms and how many students you've had to move off campus into other accommodations.
So to some extent, the number is not totally set because students are still making up their mind about what they're going to do for the fall. We do have a program for remote learning. And of course, we're all dealing with the situation of international students now. So we ended up needing about 300 and some beds additional beds in the master lease apartment properties that we were in. We didn't go into any other additional properties. These were just beds in the properties that we already have master leases in. And then we are talking to the Westin Hotel and the Midtown Hotel about acquiring beds as we get a more precise number on the students, but it's probably about 1,000 students or more.
Okay. Thank you for your very thorough presentation. This is a huge challenge and there's so many moving parts to it. So I really appreciate the details that you've presented to us. The other issue with, I think, just to echo Councillor Edwards' comments earlier about students returning to campus, are you doing a baseline test on those students coming from wherever they're coming in the country or overseas, just to establish that they're COVID-free at the very beginning?
Yes, we are going to be doing testing of every student arriving. And because we are spinning up our own testing facility, we'll be able to give quite rapid turnaround, certainly a turnaround on those test results that is much quicker than is available from the commercial labs today. So the key is to get them tested, get the results quickly, and if positive, isolate immediately.
How many, what sort of turnaround are you looking at?
Well, we believe that we can beat 6-hour turnaround.
Wow, that's pretty good. Yeah. You know, one concern I have, and it may not apply to your living off-campus living, is that sometimes when you de-densify, students move into buildings that are occupied by other residents. It's not an entirely student building. And then that would expose other vulnerable residents to students. So it's a mixed population. Are there any scenarios that you see that in any of your scenarios?
Well, I think the reason why we identified the properties and the hotels that we did is because we wanted to make sure that we could offer Northeastern supervised housing to every student who requested on-campus housing. So yes, that we don't house 100% of our students, so there will still be that population that is always looking for private apartments, but nobody who wanted housing, requested housing at the university is not going to be able to be housed by the university in either on campus or in the master lease apartments or in the hotels.
Thank you. I'm a little more concerned of the off-campus living actually in terms of it's not as well regulated, and
yeah.
When people were de-densifying in the spring, people were moved off campus and then they went to live with their friends off campus, and we ended up with not the ideal situation. So I really don't know how we police that and how we control it, but have you any plans to manage that?
You know, the plans are to make everybody who's enrolled at Northeastern feel a part of the Northeastern community, and therefore understand what our criteria and protocols are. Obviously, when they're not on our campus and they're not in our housing, it's a little bit harder to monitor what they're doing. But we are trying to create a community of caring where people understand what it means to come back and what it means for us all to share this space and this time, given everything that's created for us.
Thank you. It really is a moment when we realize how interconnected we are, interdependent and interconnected we all are. So thank you.
Absolutely.
I will not take any more time now. Chair Arroyo.
Thank you, Councillor. President Janey, the floor is yours.
Thank you. Can you hear me okay?
Yes.
Oh, thank you. Greetings to the Northeastern panel. Northeastern's in my district. I have the pleasure of working with Vice President Tobin on a range of issues. So thank you for taking time to be here this afternoon. I was wondering if you could, so the other thing I would say is I want to thank the universities just broadly. My memory is that the first confirmed case was at UMass, and that the universities did act swiftly to close their campuses to try to limit the spread. So thank you for that. I would echo the sentiments of colleagues who have voiced wanting to participate more and to see more of a relationship with the city and state. And so thank you for being here at the City Council meeting. I remember the President Aoun mentioned 2,000 additional beds. Are those the beds we're talking about here at the hotels?
Yes, we identified 2,000 beds. It's not clear that we're going to occupy 2,000, but
when
yes,
you were
it's the
talking about the
hotels.
Midtown Hotel, and okay,
Yes.
so that's part
Yes.
of that. Excellent. One of the things I think that would be helpful for us to understand is with the general population of Northeastern, how many are housed on campus? What percentage of students are housed on campus now, generally speaking, and what percentage are out, finding apartments somewhere? And then what we anticipate through these new plans and how we navigate COVID, that changing. Do we have that information here with us today? About what percentage live on campus versus what percentage live in housing out in the neighborhoods, and then how we expect this new model to impact those numbers?
So typically when we calculate it, it looks like it's about 70 to 75% living on campus. Because we're replacing what we had to de-densify on campus with the occupancy in the hotels and the master lease apartments. We haven't calculated it, but I wouldn't expect there to be a huge difference given that everybody who wanted to live on campus is going to be able to live in something that we're arranging for.
Right, but are we also accounting for changed behavior? Because everyone who wanted to live on campus pre-COVID may not want to live on campus post-COVID. They may now say, it's safer just to get a roommate situation and deal with these 3 other people versus 300 other people. So are we anticipating behavior to change in terms of housing and who wants to be on campus? And then I have questions just related to behavior in general. I think part of the concern as things reopen in the Commonwealth is that people are a little bit more laid back and laxed, whether they're covering their faces, whether it means gathering in crowds. As you see, when our bars and restaurants first opened, we saw a bunch of behavior. We see spikes in terms of confirmed cases going up. And I worry, and this is not to stereotype young people, but when we saw this happening in the bars, it happened to be young people. And so we all want to make sure that our students are safe. And so, whatever guidance beyond, I heard someone earlier speaking to cleaning and how there's a lot of cleaning that's going to happen, but how do we deal with kind of that behavior, the culture on college campuses, and making sure that our young people continue to take this serious, that students are taking this serious, and that the universities themselves are providing not just the guidance, but the mechanisms in which they can then be safe?
It's a great question, and it's one that we struggle with every morning to figure out not just what we're telling them that protects them, but to tell them what's appropriate to have an enriched life by coming to our campus and participating in the Northeastern experience. We're actually now looking at all of our outdoor spaces and trying to figure out how, with refurnishing and perhaps creating some spaces where you could have activities so that students don't have to go someplace else, but can gather safely and can I actually constantly use the word joy. It's very important to me that we understand that young students need to enjoy themselves. And that's a part of what we want them to do while they're doing their learning, while they're conforming to all of the testing and other requirements that
Yes,
we have.
and that's a very important part of campus life and college life, is that college experience and the memories that students will take with them and for the rest of their lives, the friendships that they will build for the rest of their lives. That is very important, how we navigate that. And I wonder how you do that safely in common spaces. You mentioned that there would be regular cleanings in some of the common spaces. What kinds of guidance? And I don't know what all of the common space, I imagine it's like the big cafeterias and other open spaces. So those
dining is going to be very different.
Yes.
So the healthy distancing, and when people wear masks, obviously you can't wear your mask while you're eating, but when you're walking in and out of when you're eating, you have to. And changing the furniture. But we sort of call it a campaign to try and educate everybody about how to do all the things that they have to do and not have it interfere with the whole reason why they came to the university to begin with.
Right. The last set of questions, again, are just coming back to the beginning and around how we strike this balance between receiving students into our neighborhoods who are getting world-class education and really having them be part of the neighborhood and alleviating the tension that often happens between our students and our neighbors, our residents who live in these neighborhoods. And so I'm particularly, again, worried about, whether or not the universities will be able to embrace and take care of all of the students without students spilling over into neighborhoods. I worry that some students may choose not to live on campus because they're fearful, and that we will see a rise in students competing for apartments out in the neighborhoods. So I do worry if that's an ongoing issue pre-COVID, and now with COVID, I worry that COVID will exacerbate that concern. And so I would be interested from the university's perspective, what ways you can think of ensuring that young people do have access to good quality, safe campus dorms so that we can alleviate some of that tension in the neighborhoods. And that's it for me, Mr. Chair.
Thank you.
Well, just a response if there's one.
Yeah, if there's a response to that.
That would be great. And then that's it. for me.
I take it under advisement, and I totally understand and acknowledge the issue you're raising, but I don't have a solution right here.
Okay, so I would encourage us to continue to be in dialogue with each other, because I imagine that is going to be a contentious issue as the housing supply gets, as people are competing for housing. But anyway, let's continue to talk. Thank you, Mr. Chair. Thank you again to the administration and to the panel here from Northeastern.
Thank you. Councillor Bach, followed by Councillor Flaherty.
Thank you, Mr. Chairman, and thank you to Northeastern so much for being here today. And I'm very encouraged to hear about the plan for testing at scale on campus, and also testing, everyone right at the start. I think I said earlier in this hearing that, to me, that moment of folks' arrival on campus and arrival in the city is really critical. And so I assume that you also have plans to ask people, to isolate upon arrival until we get back the results of that test, right? So that we can know sort of what the starting baseline is as people come in. I wanted to follow up on some of these housing questions. I mean, I think you all know there are lots of Northeastern students living in the Fenway and Mission Hill off-campus housing in my district. And so to pick up on what the president was saying, I'm curious whether you guys have thought about any guidance for students about their off-campus living situations, guidance, support. I just think that, if you're making a real effort for on-campus housing and de-densifying, and then we've got a whole ton of people crowded into apartments on Mission Hill, for instance, it's both a big concern for lots of neighbors, and obviously as those folks are part of the Northeastern community, anything that's going to spread rapid fire off campus is then going to make its way into the on-campus community too. So it feels to me like the extent to which the off-campus unofficial parts of Northeastern's world are very much part of your institutional world is going to be very real this year. And so I would love to hear what plans you have to think about supporting students in off-campus housing.
Well, I think all of the communication efforts that we're gearing up now, we do have some students back now for the summer, some co-op students who are starting to come onto campus. If you're a Northeastern student and you're part of the Northeastern community and the Northeastern family, and all of the guidelines and all of the advice that we're going to be sharing with the students who actually live on campus will be shared. They may not be monitored in the same way, but they certainly will be put forth and discussed over and over again with students in all of the activities that they do on campus. So they won't be left out, even if they're not living in our housing.
And are you guys planning on, are you planning on in that guidance suggesting a density of like students living situations when they're off campus?
We have not to date done that.
So I think that would be a good thing for Northeastern to be pushing again. I think the reality is that there's a lot of savings associated in the typical student economy with fitting as many people into a small space as possible. And it comes with the public health interest here.
Yeah. Noted.
And in terms of cost, I guess that's my other question is like, I mean, I imagine as you guys think about these master leases and all, there's a degree of expense in all of this. And so I'm wondering like, and one of our frustrations on the city side, and this is true at Northeastern, it's true at a bunch of universities, is that sometimes it feels as though just the price point of dormitories are part of sometimes what encourages students to go into the off-campus market. And I wonder, I do worry about what the delta is. I have, it's funny, I think I have a slightly different intuition than President Janey. My intuition is that we'll have enough folks not coming back for September 1 leases, that apartments will be pretty plentiful this fall compared to normal, which then may mean that their rents decrease. And so I'm sort of concerned about what's the price point to make sure that on-campus housing is a real option for students from across all different like incomes. And so I'm just sort of curious how you're thinking about the pricing.
The pricing is what it has been previously. And so it costs a certain amount to run the dorms. Where we're adding new spaces, we're sticking with, we have different levels of housing. There's different amenities that come with housing. There's typically difference between a single and a double, but because we're de-densifying, we're not changing the basic cost of housing for living on the campus.
So does that mean like, since you're de-densifying, that everybody then pays sort of at the single rate? Because
No, that's what I'm trying to say. I'm probably not being as articulate about it, but no, we're not penalizing people because we're de-densifying.
And how does all of this apply to, it came up early in this process that I know you guys have a large dorm that's technically not owned by you. It's leased, there's a private company. It came up because a number of students wanted to break their leases and the company was less than accommodating. And I'm just wondering how, I know it's right in the midst of your campus. And I'm just wondering how like a facility like that falls into your plans.
So that's Lightview, the dormitory that's on Columbus Avenue. And they did develop a program where if students submitted their situation, they gave more consideration to it than they had when they originally started. That's the only example of that, is that building.
And so what will that though, is that building coming under the de-densification plans? Like how is that factoring into
that building is all apartments. And so none of the bedrooms are more than one or two to a bedroom. So they didn't have the same need to de-densify that we had in our dormitories on campus.
And can you talk a bit about, in terms of guidance, I guess I just want to articulate that I think there's a huge amount of concern, and I think especially in Mission Hill and Fenway, that one of the things that we saw when universities closed in March was that a lot of students who were on campus went to their friends off campus. And so there was actually like, as we de-densified the university campuses, there was a densification of the off-campus communities. And where I could see that being a similar dynamic this year is in terms of gatherings. Like, as you said, right, as the university imposes kind of important public health restrictions on how many people gather and in what proximity they're in. I just think that our perennial issues of packed undergraduate parties outside of supervision become all the greater, but also the consequences of them become greater, right? We go from the consequences being the very real, like, quiet enjoyment issues around noise and light and lateness into like making neighbors feel less safe. And so I really feel like we need all the institutions, including Northeastern, to grab that bull by the horns too, and try to think about how we're going to solve for that, not just the events happening on your campus.
Mm-hmm.
So have you guys thought about that?
I think the way we've thought about it is, and I hate to keep coming back to the same thing, the sort of constant communication of what it means to come back to campus and to be a member of the community, no matter where you are living, no matter where you go in the city of Boston, that we're trying to inculcate that. I will say one other thing, which is we do have some help in that parents are very interested in their students coming back, mostly coming back to campus, but also interested in their students behaving in a way that is healthy and safe.
Council Bach, if I may just jump in on that, as you know, and this dovetails on something that Council President Janney had brought up about off-campus behavior. You know that we have spent a lot of time in this office in city and community engagement, both with you and your short time on the council so far, and your two most recent predecessors. I spent a lot of time in terms of enforcing and letting people know what the rules are who live off campus, whether they be in the Fenway or Mission Hill or in Roxbury or on the South End. We spent a lot of time on that, and in cases where we ask kids wherever they come from, whether they're from Boston or Massachusetts or somewhere around the country or from around the world, to behave the same way in that neighborhood if they live off campus as they would in their own neighborhood where they're from. So we're going to reinforce those efforts as we move forward, particularly in those large gatherings, and we'll continue to work with your office and Councilor Janney's office and the other city councilor in terms to mitigate, any types of those problems as they arise.
Yeah, thanks, John. No, and I think the trouble is, of course, that we just, those efforts have seen mixed success, right? And so then the challenge is the to the degree at which they fail. And look, keeping undergraduates from gathering is a challenge in all times. Like it's just that now we've got this additional potential major public health effect of failure. And so I'm just, I really want to register that I think that we need to go above and beyond what we've been doing in the past, right? And so does that look like some more proactive, identification of, I think, of certain streets? There's some music in the background.
We're also at 7 minutes, so
okay, sorry. Okay, I'll just say it's an ongoing conversation we should be having. Let's just think about identifying ahead of time the hotspots, and maybe some more proactive supervision that we could have, and those would, I think, help set the neighborhoods at ease. Thank you, Mr. Chair. Sorry.
No worries. Councilor Flaherty, followed by Councilor Councilor Flaherty for now.
Thank you, Mr. Chairman, and obviously thank you to Northeastern, like my alma mater, Boston College, and my law school at Boston University. And you also attract top talent to our city. You help drive economic growth in our neighborhoods, and you also employ thousands of residents, many from our city and obviously throughout Greater Boston. So I'm also have had the privilege of serving with my former colleague, Councilor Tobin, who I think adds tremendous value. He's a true Bostonian, born and raised. He knows the city, he knows the neighborhoods, he knows the communities within those neighborhoods. And I trust his judgment in terms of anything related to Northeastern as we continue to move forward here. So just want to state that for the record. And while I have folks from Northeastern, want to maybe try to get a sneak peek with respect to the sports programs, particularly if they are going to be back up and running. What will the fan situation be like? Are there thoughts to be given on that front? Also wanted to know whether or not you guys have fraternities over there and how you're going to handle that. And lastly, on the cleaning piece, as referenced earlier, want to get a sense as to who you guys are using to do your cleaning, and we dialed in terms of what the certifications are. Are they tier 3 certified? And what cleaning materials are they using to make sure that when spaces are being cleaned, that's being done to the highest level possible based on appropriate guidelines. And that's it in a nutshell. So whoever wants to take those on.
I'll do cleaning.
Do cleaning, Kathy.
John, you want so we are regulated by Association of Higher Education for the level of our cleaning, and I think we're at the highest tier actually that's required, and we our vendors who help us do the cleaning are required to meet the same standards, and all of the extra cleaning that we're now doing because of COVID-19 is we are prescribing, if people are on campus and doing their own cleaning, that they're using the same products that the EPA approves, that our cleaning vendors and our staff are doing, and they're doing it more frequently than they would otherwise be doing it. We're exploring a number of different, as new things are recommended for the cleanliness of air and the cleanliness of surfaces, we're taking them very seriously, and we're sampling some of those things. And if they work and they make a difference, we're committed to being, right at the front of whatever we can to be able to keep the campus safe.
And Councilor Flaherty, I think you had asked about fraternities and athletics. I mean, there are a handful of fraternities associated with Northeastern, and obviously treat those in the same manner that we would any other students living off campus in kind of those accelerated efforts, if you will, and work in conjunction with you and your colleagues when those issues arise, but also being proactive as well. And then you also asked about athletics. There's been no decision made on athletics for fall as of yet. I know other conferences are around the country. I know the Ivies made a decision yesterday, but there's been no decision in the CAA, which is our conference, as of yet.
Very good. Thank you, John, and thanks to the team in Northeastern. And again, I appreciate the work you guys do and the partnership that you have here with the city.
Thanks, Council.
Thank you, Councilor Flaherty. We now have Councilor O'Malley, followed by Councilor Flynn, followed by Councilor Mejia.
Thank you, Mr. Chairman. Also want to say thank you so much to the incredibly talented team from Northeastern University, particularly my predecessor and dear friend, Vice President Tobin, who I know has been absolutely committed to doing everything he can so that the university opens up safely, and obviously the well-being of not only the employees, staff, faculty, but students and families is paramount. So I don't have too many questions. I apologize that I stuck out the last round. I will be reviewing the tape, but I guess my question, and this may be for you, John or Kathy or David, are there any specific steps the city could be doing to both help you and the other universities and colleges, particularly in the Fenway area and those that are within the city limits, as it relates to opening up? You know, certainly we've been, I think, fairly nimble working with the business community and lifting certain restrictions. That's more of sort of an economic impact piece that would be less with you guys. But I'm just curious, as we talk about, you know, envisioning opening up our own schools, both public schools and some private parochial schools in the city. Are there ways that the city can better support our colleges and universities, and most importantly, our students and staff that work there, as it relates to opening, you know, in a time of great uncertainty, in a time of great peril, in a time of, some real concern as it relates to the health and safe being of permanent Bostonians and temporary Bostonians?
Councilor, I think the communication with the city has been, you know, since this pandemic started, you know, the communication with the city on a whole host of things where we've worked in partnership on different things that have arisen, you know, in the last hour, and they need help. And the communication has been really, quite honestly, wonderful. It's been with several of city council offices as well. I just think it comes down to, instead of protocols, just comes down to communication and talking with each other. Since it started, you know, things change on a dime, and what we say today could be different tomorrow based on events that come up. So like some of my colleagues have said, we just have to be nimble and think outside the box and be innovative and work together. And you know, we're grateful that the BPDA is released their guidelines on off-campus housing, particularly as it relates to hotels. And so we look forward to those applications and continuing that and working with communities where those hotels are to assure and allay any of the concerns that neighboring residents may have, or businesses.
And I guess to that end, how is the communication and partnership among the between and among the various universities and colleges? I'd assume the good-natured taunting at many hockey games between BU and Northeastern have been put on hold for a moment, and I assume you guys are working well together, recognizing there's going to be a lot of overlap and a lot of shared desire as things begin opening up again.
Yeah, though we did win our third men's beanpot in a row, and our women were ranked third in the country before this started, and an unbelievable hockey team. We've put that taunting on hold, and I'll tell you, it's been great. A lot of my peers at neighboring universities, we speak every single day. There's no competition. It's about sharing ideas, sharing thoughts, best practices. It's been really, this has been a real, tragedy in so many ways, this pandemic, but there's been a lot of good that's come out of it too. And a lot of new friendships, working relationships, sharing of ideas, and just, when they say we're all in this together, it really, it's really been the case.
Well said. That is all I have for now, Mr. Chairman. Thank you, ladies and gentlemen. Appreciate it.
Thank you, Councilor O'Malley. Councilor Flynn.
Thank you, Council Arroyo, and it's good to see John Tobin and the other government affairs professionals at the various colleges and universities. I think you have a good plan. It was informative. I'm glad you have a good working relationship with the city of Boston and with the city council as well. So I want to acknowledge that and congratulate you on the hard work. I have one question, I guess. When students are in hotels, when they are moved into hotels, what type of security and public safety are we providing students to make sure that they are safe, that people just are not able to randomly go into hotels if they're not supposed to be on a certain floor, or are the rooms going to be blocked off? I just want to make sure that the students are as safe as they possibly can be.
Yeah, we want to do the same thing. We are occupy at the Midtown. We're actually going to occupy all of the rooms. At the Westin, we're occupying floors, an entire floor. And we actually just had our Northeastern police go through it this week to make sure that there's a proctor type station that makes sure that the only people that can get onto those floors are the students who are living there. They'll have special keys to their rooms. We are going to treat it like it's a dormitory, and there will be staff on every floor, and we will do everything that we would do in our own dormitories to try and make sure that they're safe. We did have some students in the Midtown hotel in previous years, and so we've kind of figured out how, even if there are guests in the hotel, which unfortunately right now for the Copley area hotels, there are no guests, how to make sure that we have an area that's private for the students.
Thank you, Kathy. And maybe just a follow up for those students that are going to be living in or staying in hotels. What type of ongoing services are you providing them, just to make sure that their quality of life is also addressed, and that they have everything that they need?
Well, there will be staff there. They actually will be having a lot of their courses on campus, so they won't be sort of isolated from campus life. And we are very serious about making sure that they have a Northeastern experience that makes them appreciate what it is and continue to come back semesters in the future. So there'll be a lot of programming. There'll be a lot of staff making sure that they have access to all the things that people on campus have access to. It's why we're sort of fortunate that there's hotels that are so close to the rest of our campus.
And in the category of health monitoring and safety, they'll be fully integrated into the daily health check system, as well as fully integrated into the testing regimen that we will be doing.
Excellent. That's all the questions I have. Thank you, Councilor Arroyo, and to the other sponsors for this important discussion.
Thank you, Councilor Flynn. I believe the fireworks task force is meeting, so Councilor Mejia and Councilor Sabi George are both on that task force and not here right now. Councilor Edwards, followed by myself. If you would like to ask an additional question on the second round, please raise the blue hand. But Councilor Edwards, the floor is yours.
Thank you very much. Can you hear me?
Yes.
Excellent. So I appreciate a lot of the commitment from the universities. I think the only question I really then had was, because of the hotel university kind of dorm mix, we just passed a resolution yesterday for hotel workers about daily cleanings. So how are you dealing with it? And the issue with that was around the pandemic and safety, and the fact that people are using hotel rooms as places to congregate, making it actually more of a healthcare issue in the pandemic. So we're going to treat this as normal dorms. And if I remember dorm life, I congregated in all my friends' rooms and I was there all the time. And we were, whatever parties we would have, and that's how we treated it. How are you dealing with then cleanings? How are you dealing with this issue?
So there will be limits on how many people can be in any of the hotel rooms. There will be limits on visitors. So the only people who would be able to come in to your hotel room would be another student who lives in the hotel with you. And we don't clean the dorm rooms. We empty trash, we clean all of the shared space. So there will not be hotel staff going in to clean the student rooms. There are certain security requirements for staff that go into our dorms and work particularly having access to the student rooms. So we'll be treating the rooms in the hotel the same way. How will we be able to monitor in every case that there aren't more than the number of people who are restricted to a room to be in a room is a good question, but there will be staff on every floor. So I would hope that we could treat it the same way we're going to treat the dormitories on campus.
You clean your common areas regularly?
We clean the common areas, yeah.
So in the hotel floors that you have common areas or places, will that be cleaned by?
By hotel workers.
By hotel workers.
Yeah, it's just going into the private rooms of the students.
So in as much as there's going to be I understand there might be some hybrids where there's a floor of a hotel that's students, and then the other parts of the hotel might be open for regular business.
Not floor by floor. There won't be a mix on a floor.
Correct. So if there's 4 floors, you might have the bottom floor, and then the hotel might have floors 2, 3, and 4 open to the public. Correct?
Yeah, we're not taking every floor of the hotel, right?
So again, the marrying of the 2 different standards for cleanliness and health is a concern to me. The hotel workers will be hopefully cleaning regularly those rooms upstairs. If your students' rooms are not being cleaned regularly, then how is that not a risk to patrons of the hotel coming in and visiting? Are there going to be separate entrances? Are there going to be separate ways in which folks can go? Are there going to be separate hotel or elevators? Like, how's this work? One group is going to have regular cleanliness standards for the health in the pandemic. The other group is not. How are you planning on marrying that safety-ness?
So the hallways will all be cleaned. Every space that the students are in, besides when they're in their private rooms, will be cleaned with to the same standard. So your question is, if the students don't keep their room clean, is that a risk to other people? Is that?
The question is that there's 2 different standards for the same building because of a health care crisis that we are in. So one standard is requiring daily cleanings of the rooms, right? Of the folks who stay at the hotel because we're in a pandemic. The other one is not requiring that at all because it's privately occupied by the students. So you have two different healthcare standards in the same building in the middle of a pandemic. And I'm wondering how those two marry at
So
all.
it's not special cleaning because you have different people coming in and out of the, over time occupying the rooms. That's not the reason for the standard that you're talking about.
And Kathy, if you'd allow me to put
Please.
something in the mix here. So also we need to recognize that in terms of reducing risk, the student population in these hotels will be the most monitored population with viral testing, because we have put together this very robust program in terms of testing for virus. So actually far more than the general public, because the university is doing this on its own. So that also needs to be factored in, and that's a great risk reducer in terms of the potential in terms of the students being a vector. And then as Vice President Spiegelman spoke to the fact of the no visitor policy that we have in our dorms and in those floors of the hotel, those hotel floors are really going to be controlled to be only the students who live on those floors. So there's a number of things that actually are risk reducing that are beyond just cleaning.
And is this going to be a standard per hotel and per university to negotiate, or is there going to be for universities in partnership with the hotels, is there a uniform standard for cleanliness, for visitation, for I don't know, for monitoring, all of those different things, or is each university doing each individual negotiation for each building its students are in?
That I couldn't answer because we've only been negotiating with Weston for the Northeastern occupancy of the Weston Hotel. So there are clearly state mandated requirements that the hotel is obligated under. And then there are requirements that the university is operating under. So those wouldn't be different from one site to another. But I imagine that when we submit our applications to the BPDA, as we just learned today, is going to be the process, that the answer to your question will be clear.
That's all I have, Counselor.
Thank you, Counselor Edwards. And so I will now ask my questions before we turn to Counselor Bach for a follow-up question. Is essentially all campus housing going to be a single housing unit now? Or is anybody going to have a roommate?
Yes, there will be doubles.
Okay, and so in that situation, if somebody, and there will be positive tests, somebody will end up infected. The question is, when they have to quarantine and isolate, what is the university going to do? So in the instance of somebody coming back positive on a test who is living on campus or living in a hotel situation, what is the university response to that? Are we mandating that they go home? What's the quarantine situation? Are we going to create a single for them if they're in a double? What are we doing for them?
So if
David, do you want to answer?
Sure, yeah. If they're COVID positive, so I'll use the term COVID positive to mean infected with the virus, active infection with the virus. Yes. If they are COVID positive as a result of a PCR positive test result, then they will be moved into isolation. If they have a roommate, their roommate would be scheduled for immediate testing. And then the roommate is going to be monitored on a more frequent, the roommate of course would be by definition of close contact, and the roommate would be monitored on a more frequent and in quarantine, self-quarantine is the policy. With regard, so that will be the policy for all students in terms of getting them protected or isolated from the rest of the community. And that's what we're going to be using. And of course, public health guidance is the whole bounding, we actually work with the Public Health Commission and make sure that we implement all of their guidance and all of their processes.
And so if somebody is COVID-19 positive, the university has set aside spaces that they'll be isolated into. Is that the idea? You have set aside dorm space or whatever it is for them to be in?
Yes.
Okay. And so as far as that student goes, is there an additional cost that will be incurred on them? Is there any kind of fee being imposed on them if Northeastern has to quarantine or isolate any student? Is there any additional cost to them? In other words, if they're being quarantined in that way, I'm assuming that means food will have to be delivered, certain things will have to change for them. Is there any cost that's going to be incurred on that student, or is Northeastern essentially taking care of all of the particulars that go into a quarantine or an isolation?
Yeah, we are developing these programs as we go along, but I have not heard of any plan for additional costs.
No.
And go ahead. I didn't mean to cut you off.
No.
Okay, and so one of the questions I have there, which you kind of sort of hinted at, is if someone's COVID positive and they've now been quarantined or put into, well, at that point they'd be in quarantine status, right? But you're going to have to require, say, a roommate to be isolated. Are they sharing, in terms of the dorms, are they sharing common spaces? Is that going to be allowed? In other words, are they sharing cafeteria space? Are they sharing study halls or libraries? And the reason I ask that is, if you're going to do contact tracing and you're going to require isolation, self-isolation with what would be a close contact, in other words, somebody was doing the regular course of business, was eating in a cafeteria, was in a common area. I was on a dorm when I went to undergrad, and there's a lot of passing of folks in hallways, even if you're containing the social distancing. What's the isolation rules here, and what mechanisms have you set up for one, containing what could possibly be an entire dorm building or an entire library, or what is the goal in the plan for that if that occurs?
So Kathy, this is space, so you can help me out here, but all isolation rooms have their own bathrooms, is my understanding. And so that, removes a lot of that. They will be, of course, we will not allow any COVID positive students to be intermixing into the community in any way.
Sorry, I might have been unclear. I didn't mean after you've already identified them as COVID positive. I assumed that. I mean, when they've been identified as COVID positive, you now have to do the contact tracing. So in other words, somebody gets tested, now their roommate has to get tested, now their classmates might have to get tested, the professors, the folks they saw in a cafeteria, the folks they might have seen at the library. And so my question is sort of two parts. One, do you have these shared spaces still? So libraries, cafeterias, common areas, are those going to be allowed to be used as shared spaces by students? Or are they essentially just given their rooms in classrooms and everything else is sort of closed off? And if the answer is, go ahead there.
Yeah, so we have Vice President Tobin mentioned this program called NewFlex. So NewFlex is this system we've put in place that will allow students to either be in the classroom or to be taking classes in real time from outside the classroom. And because that was done as a means to promote distancing, it also becomes a means by which any student in quarantine will never miss a class. So, so that's a very important piece. So when you said it's only classrooms in their own room, no, they don't have to go to the classroom because NewFlex provides the ability to maintain their education as possible. The plan,
David, I think the question is the contact tracing, whether or not in contact tracing, everybody that you identify has come in contact with the positive person.
Right. I'm talking
what is
about
the
these
responsibility
people.
to that?
Yes.
Yeah.
I'm talking about these people. So they will be in self-quarantine, just like the state rules right now, right? So if you are a close contact, you're supposed to go into self-quarantine, which is essentially a stay at home, right? And that will be what the situation will be for those students. They will be stay at home.
So I guess the issue with this that I'm having, and maybe I'm not being clear about this, is what community spaces? I'm assuming if you're going to have people on campus, the purpose for that is to provide some sort of campus environment, college level environment, where we're sharing ideas and we're sitting in common spaces and things that come with a college environment. So with that granted, are libraries open? Do you have libraries? Are they going to be open to the public and to the staff and to the students? Are your libraries open to students?
Libraries are going to be open and students will be wearing masks and required to be 6-foot distancing when they
And-
are in the library.
Good to know. Cafeterias, are they open?
Same thing. There's going to be dining, but it's going to be reduced density. So we're looking for multiple spaces on campus where people can, dining will be different. They'll be taking their food and they'll be able to go eat someplace.
We had a
They'll have a mask on except when they're eating, and they'll be eating at 6-foot distances.
Got it. And do you have shared showers and shared, in other words, shared bathroom spaces that more
There
than one?
are some dorms that have shared bathrooms, and they will have rules about how many people can be in the bathroom at a time. And they will have signage if there are sinks next to each other that they're not used at the same time, et cetera.
Okay, perfect, great. And so that answers kind of sets up the next part. So if I'm a student and I test COVID positive, it's possible that I've been in contact now with folks in my dorm, sharing a bathroom, sharing a classroom, sharing a library, all of these different spaces. If that's one person, I'm assuming you're tracking down possibly dozens of contacts at that point. If it's multiple people who are COVID positive, you may be at any given point in time tracking down dozens of contacts. And so asking all of them to self-isolate, I guess the question is, what is the plan for that? Obviously you have rapid testing, which I appreciate. I think you said 6 hours is what you think you can do, so you can test some of these folks out. But in terms of tracking these folks down, which could be numerous people, what is the plan? Is that I saw something about an app? Is there some kind of what is the apparatus or response for getting in touch with these folks in rapid fashion for what could be, you know, dozens of people, right? Like, what is the plan for that? If you could just give me that, and that'll be my final question before I hand it off to Councilor Bach and Councilor Braden again.
So we have both technology and human-based components of our solution and our program for contact tracing. So in the classroom is an environment in which masks will be worn, and then of course you know, the issue is not just in the classroom, but in the classroom in close enough contact to be a close contact, right? So we're doing everything on campus to mitigate the close contact issue, and at the same time, we will have a robust program for close contacts. Now, with regard to, you know, we will be working with the public health authorities in terms of developing an understanding of how we can combine self-quarantine with robust testing as a means to better understand and even more reduce the risk than is typical out in the population, where if you are a close contact, you self-quarantine and you wait a period of time, but during that time, there's no orders to be tested to so really know if a close contact is becoming infected. Our plan and our ability to test allows us to stay much more on top of our quarantined population so that we can very rapidly determine if somebody who is a close contact has actually been exposed to the virus in a situation that they will become infected. And, you know, as the science develops, and I think Vice President Spiegelman mentioned this before, our approach is, you know, 100% science-driven and science-based and data-driven. And as the science evolves, as a better of an understanding of the infection cycle for SARS-CoV-2, as the virus itself evolves, we are staying on top of all of these aspects, and we're bringing all of these into our informed approach in terms of how to keep on top of the risk profile.
And so just to go with that, and I know that I said that was my final question, but you actually triggered one more. And so I apologize to Councilor Bach and Councilor Braden, I'll be quick. But if you're doing something, so if you're doing something science-driven, right, science-driven, data-based, I think that we all understand that means that you are going to have unfortunately, folks who test COVID positive. I mean, it's impossible for you not to know that somebody on your campus, whether it's a teacher, a student, somebody working in the building, is going to be COVID positive at some point in time. We're in the midst of a pandemic. And so the question that I have regarding that and that reality is, are students or faculty going to have to sign waivers or something of that nature if somebody were to get ill, if somebody were to get ill and possibly pass away? What is the responsibility for Northeastern in that situation? Is there a waiver that students are being asked to sign that otherwise they wouldn't be asked to sign? Is there a waiver that faculty or employees are going to be asked to sign? Or is that essentially a liability and a risk that Northeastern is taking?
I know that our attorneys and risk managers are heavily at work on this. I am not privy to that, the status of that right now, but you know, that is something that certainly the university will be able to respond to if, you know, in that interest. I actually have a 3:30 that I must go to because it is with the leadership of the Broad Institute. Not surprisingly, it's about viral testing of a virus, and we all are cooperating. This is the cooperation we talked about before, and this is with the very top of the Broad, and we've been working hard to get this meeting scheduled. So I actually have to jump. I apologize, but I appreciate.
I appreciate your time. Thank you for trying to answer those questions. I know I may not have been as clear as I wanted to be. Councilor Bach, I know you had a question that you wanted to follow up on. Thank you again. David.
Thank you, Mr. Chair. I just wanted to ask, and maybe this is for John Tobin, just separate from, we've been talking about student health and safety. I just wanted to check in on kind of what the employment situation at Northeastern for the fall is. And what I mean by that is sort of like what layoffs and furloughs have there been, might there be, are there areas where you're hiring people because of the new situation? I mean, just a quick kind of overview of where things stand on that front.
No layoffs as of yet, or they have been announced. So people have been working really hard remotely. This is actually my first day in the office since March. Feels good, actually. So we're just continuing on, and people, you know, really making the best efforts from home. People who are absolutely necessarily have to be here on campus are here and doing that work and trying to stand the university up moving forward. There are questionnaires going out around to different various departments. I know I sent one out from Human Resources to the folks who work in our division, asking what their preferences will be moving forward as we, you know, seek to bring people back to offices, but obviously de-densify offices as well, and give people the option, to work from home. So those are still in formulation, but nothing concrete has been announced.
And you all are planning to keep like all your dining hall workers, your janitors, like your traditional sort of staff complement, both the folks who maybe are directly paid by Northeastern and the contractors, like all of that we should expect to look the same as we move into the fall?
I'm not the right person to answer that, Councilor, but I can certainly get you that information. I have no knowledge of that. That's
okay. I think that's another really important piece to all of us. So I'd love to follow up on that.
Take note of that.
Councilor Braden.
I'll make it really quick. In the event of a student getting sick, not just COVID positive, because a lot of students are asymptomatic while they're positive, but someone who gets sick, does the university have a relationship? What's the role of university health services, first of all? And if that student needs to be hospitalized, is there a protocol for transfer to a hospital, and how is that going to be managed?
Yeah, this is, students getting sick is not a new thing. So in fact, we've had experiences with needing to isolate students in the past. So we do have a university health services on campus. We do have relationships with the area hospitals. Obviously, the closest ones are the ones in the Longwood medical area. And our university health services staff works very closely. If a student needs to be transported If it needs an ambulance, fine. If it needs another kind of transport, we make that available. So we do anticipate that some of the students will be able to recover if they test positive in the housing that we're preserving for them with services provided to them there. But if not, we absolutely will seek medical care beyond what the university can offer.
And sometimes with this virus, people have like low-grade symptoms, and then all of a sudden there's a sudden deterioration. Is there a protocol for your health services to monitor those students on an ongoing basis?
Yes, there is.
And then, what is your plan for immunosuppressed or other vulnerable students and faculty who will they be required to be present, or can they do the remote learning or the remote teaching model?
I think, everything's a case-by-case basis. For students, part of why we developed this new Flex, and we actually have another program called NU Start, which students can be totally remote, was to allow students to participate in their education at Northeastern sort of anytime, anywhere. And so if a student can't come for reasons that have to do with health, reasons that have to do with a visa, reasons that are beyond their control, we work on a case-by-case basis to do everything we can to make sure that that student can still participate and move forward in their education.
Very good. Thank you. Thank you. Thank you all for your participation. This has been very helpful. Thank you.
Thank you. And thank you again for your time. I know that time's short, but I saw that we were joined by Councilor Asabi George, and we still have Northeastern here if you have any questions.
I do have a quick question, if that's okay, Chairman Arroyo, and thank you to everyone for presenting. And I'm sorry for leaving and coming back late. I am curious if there's a plan around quarantining larger groups of students, if there is an outbreak in a particular building or space, what the response may be for sort of a larger effort as opposed to removing one student or a few students.
Yeah, well, we're keeping over 500 beds on in our campus housing to be able to accommodate whether it's single students at a time or whether there's a group of students. There's some research that says sort of people who are sick but can be together do better than people who are sick and have to be alone. So I think our University Health Services, a program we have that's called We Care, will be servicing each student or group of students with their needs. And again, like my answer to Councilor Braden, it isn't new for us. The new part is the virus that we just don't know what to expect, but taking care of students when they get ill or present with cases is something that our student affairs group is very familiar with. And we have a lot of confidence that they're going to be able to manage through it effectively.
And then if it's teaching staff that become sick or unable to continue with coursework in the public school, in the K-12 model, we have substitutes that can continue an assigned curriculum. How does that work for academic purposes if an instructor is sick?
Again, it's a case-by-case basis. There are some classes that somebody else can pick up, and there's some classes that it would be hard to do that. There's, we have to work that through case by case, and hopefully the new Flex system allows faculty to be able to teach sometimes in the classroom and sometimes not in the classroom. So it makes it easier than it would if in fact everybody had to be present every day.
And then related, but not directly to any sort of infection, some of we know that there's some challenges now with our international students and them being able to be here in the States to go to school if school is just done online. What's the efforts on your campus around supporting those international students with their visa challenges from the federal government?
We just reached out to all of our international students to make sure that they know we'll do everything that we can. We do have this hybrid teaching model that isn't all online that we're hoping will help some of them, but in other instances it may not be enough. And we're certainly very supportive of the work that Harvard, MIT, other universities are doing to try and not put a kibosh on educating international students. We're really hoping that doesn't happen.
And Councilor Asabi George is a great question. And it's a deeply personal one, for President Aoun, who came to the United States as an international student. And he issued a pretty strong statement of support to all international students last night in an email.
Great, thank you. I appreciate both of you here, and thank you for that. And thank you for your president's position on those international students. Thank you, Mr. Chair. Again, sorry for returning late.
Thank you so much. And I just have one final question before I let you go out. The app that you have and the notification services that you have for faculty and students, are employees like cleaners or folks that are working, not necessarily school faculty, not students, but folks who come in contact with your buildings and with your classrooms and with students, are they going to be part of that notification system? Are they going to be allowed to know whether or not they have come in contact with folks who may have came up COVID positive? Are they in that system, or is that system restricted to faculty and staff, and Northeastern staff and students?
If the contact tracing identifies that anybody has come up, whether they're a Northeastern person or somebody else, the process will certainly include them. Whether or not the actual app, which I think requires you to have a Northeastern connection, would be the way that we did that. That might be the sort of human element that Vice Provost David Luzzi referenced, which is we are hiring people to be contact tracers that wouldn't differentiate between somebody who was a Northeastern,
I'm mostly
Northeastern ID or not.
Yeah, I think that's what I'm mostly interested in trying to find out. If you're somebody who's cleaning these rooms, if you're somebody who's serving food in a cafeteria, and how would you said if they come up as somebody who's contact tracing, I would assume they would come up if somebody's eating in a cafeteria or they're living.
And then we would probably work with the employer to make sure that whoever it was that was in that area was notified. And in fact, we did that last spring.
Yep.
When we were.
Basically, what I'm trying to find out is there a system set up for that already? That's basically it. Because I know you have the app system already set up for faculties and students, and there's also.
Yeah, I think some of those contract workers probably don't have the app. They're not on the app, but it doesn't mean that we wouldn't find a way to communicate and make sure that they get the same information and access to whatever it is that we need to do.
Okay, well, I look forward to seeing that when it's more concrete in terms of how you're going to contact with them. I know it's July, but I know that we're still putting together plans and things of that nature. So thank you both. If you have any closing things that you'd like to say, I would like to give you the floor if you do have anything that you'd like to close with. But otherwise, thank you again for staying with us. I know this has been a long process, and I appreciate you trying to answer these questions, some of which you're still formulating and creating the plans for. So thank you so much for that. I know how difficult that can be.
Grateful for the opportunity, Mr. Chairman, and your colleagues. Thank you.
Thank you.
Thank you.
And you're free to go. So unless you want to ask anything, you don't have to be here anymore.
Thank you very much.
Thank you.
Bye.
Thank you. Thank you both.
And so with that, I'm gonna now head into our labor. We have Jamie McNeil here, Roxana Rivera, and Jason Prentice. Thank you so much for your patience. I'm actually gonna just ask, and if I get the thumbs up, then I'll do it. Otherwise, I'll go right into this. I don't know what your schedules are, but we do have a number of folks, about 10 folks who are here for public comment and have been sort of waiting, and I promised them after the second panel we would do it. But if folks have a time restraint, because I know you were supposed to be the second panel, now you're the third panel, I can go right into kind of your presentation. And I think one of the ways we could do this is, if you'd like to present, I'd like to let you present, and then I can go into public comment, and then I can kick it to the counselors for questions. Does that work for our labor folks online right now? Perfect. With that, let me just give you more of a update for folks who weren't here earlier. Roxana Rivera is the director for SEIU 32BJ Local 615. Jason Prentice is a member of SEIU Local 509. And Jamie McNeil is an agent at Unite Here Local 26. And so with that, I'm going to actually kick it right over to Roxana Rivera for your opening statement, followed by Jim McNeil, followed by Jason Francis. Thank you so much for being with us. Thank you so much for your patience.
Well, thank you for having me give some testimony today, and hi to all the other labor partners as part of this panel. So I'm Roxana Rivera. I'm the Vice President of SEIU 32BJ. Our union represents 20,000 cleaners, security officers, and maintenance workers throughout Massachusetts, including 5,000 that work at higher education institutions such as Harvard and BU, BC, Northeastern University, Tufts, among others. Obviously, as you can assume, our workers cannot work remotely and have been they've been essential workers throughout this pandemic. Though hundreds of our contracted cleaners working for vendors at many of these institutions have been laid off, thousands of others have continued to, working directly for the universities or contracted out, have continued to work on these campuses. So during the initial surge, we were getting daily calls from workers that we represent at these institutions with concerns over exposure and contracting the virus at work. And we were then in direct contact with the institutions or the vendors to do contact tracing to ensure that other workers were quarantined as soon as possible. But despite these efforts, right, hundreds of workers we represent did contract the virus, and even with less people on these campuses, and sadly some have died. So as institutions of higher education look to reopen, we have been emphasizing the need to adopt practices to ensure the health and well-being of students in the broader community in the areas of cleaning, maintenance, and security at these campuses. So we know that the utilization of the buildings itself as higher education looks to reopen will change, right? And there will, as you've heard through the testimony today, there will be an increased need for deep cleaning, disinfection, and increased cleaning of high touch surfaces. Campus cleaners and maintenance workers and security officers will be even more critical in the coming months to ensure that students, faculty, and staff all remain safe. Unions should be considered a valuable partner in addressing the changes now needed to combat the spread of COVID-19. Unions representing direct employees and subcontracted workers should be consulted in the development of these policies. Consultation early in the process with unions can help to ensure a smooth transition when they reopen. Many of the workers we represent at the higher education institutions have already been asked and have been cooperating with testing requirements and or temperature checks. Because of our union's experience representing cleaning, maintenance, and security at institutions of higher ed, we have developed a best practice that we are urging institutions to adopt. And this, spans from, ensuring the appropriate PPE to training on protocols or new protocols or equipment for workers. The example of that Councilwoman Janey talked about with UMass, the cleaners that we represent that are contracted out were the first to, be asked to clean the area in which the student was present at UMass, and workers were concerned because they didn't have all the information at that time about what they were doing, and were concerned that they didn't have the appropriate protection. And I think, since then, I hope we have learned more So thinking about, having protocols for when workers are being asked to clean an area where, a member of the campus community has contracted the virus, such as in dormitories. Also the issue with ensuring that, there's the hiring of adequate number of workers. I mean, there's been a lot of discussion here about the need for more cleaning, but again, making sure that we have the appropriate amount of workers to make sure everything is safe. We've encouraged also the issue of limiting for example, the use of the campus facilities to third parties or events, limiting the number of faculty, like as what has already been kind of spoken to at some extent here in this hearing about faculty, limiting the number of faculty and staff in common areas, or number of students or other staff allowed in any building, in any one building at any given time. We as workers, and I speak, in saying what I'm, in saying closing, in closing, I say it as our union, but also unions, other unions on these same campuses. Collectively, we represent hundreds of workers working on these campuses. And, we're all committed to basically help the universities and colleges, succeed in these uncertain times. We need to be seen as valuable partners. But in order for this to happen, the universities and colleges need to engage us and need to engage in the workers. There has to be a commitment from the universities for full transparency. What we have seen thus far has not given us much confidence about this, because as the university has looked to respond to some of to this crisis, right? They have looked to cut jobs or benefits like retirement, but that were just suddenly announced without any engagement or discussion prior to, about the challenges that the universities are facing. So earlier in the hearing, Councilmember Wu raised the frustration about not having a seat at the table as the state, looked to recommendations around higher education. I think that we, and I could speak to probably for some other unions as well, that on these campuses, that in fact, as well as workers that are not represented on these campuses, that we feel that we have not been brought in or have had a process with these institutions to weigh in on these issues, and both give information as well as give ideals, given that hundreds of our workers are on these campuses and need to be part of helping to stop the virus from spreading on these campuses. Ultimately, we believe some of these decisions have been made without us. And I think this has been a blind spot for some of the universities and a missed opportunity to address the crisis with the greatest investment of all the stakeholders on these campuses. And I know many have spoken to the importance of higher education for Boston, and it is, they will play a major role in how both we as a city, but also the working families come out of this crisis stronger. So thank you.
Thank you.
Thank you, Mr. Chairman. Am I up?
Yes, yes.
Thank you, Mr. Chairman. Thank you, members of the council, for having me today. It's a very important conversation. My name is Jamie McNeil. I'm the general agent for Unite Here Local 26. We're the Hospitality Workers Union. We represent about 10,000 workers, from the casino to the hotels, a majority of the food service workers at universities, so the cafeteria workers. as well as the convention centers, Fenway Park. So we have been, over the last couple of months, doggedly, so we have our collective bargaining agreement with the hotels. We've been in bargaining with the hotels around reopening agreements. So these are obviously unprecedented times, and where there's just circumstances that we didn't know would ever exist in January that we're figuring out, especially around health and safety. We're also engaging the universities and their subcontractors around the cafeteria work, again, around health and safety, and making sure folks go back to work, but go back to work safely. And we have an equitable recovery here. I do want to commend the colleges on the testing and tracing efforts. We are doggedly figuring this out at the hotels. And we want to make sure that everyone has access to testing and tracing as a hotel worker. So we appreciate that. And, we do feel like, and I think it's come up a couple times, so I just want to make it very clear, as a health and safety issue, as a housing justice issue, as an economic issue, having colleges and universities use hotels, we believe is a great solution to all those three things. Our members live in Dorchester, Roxbury, Mattapan. They're affected by the housing crisis. Our members live in Dorchester, Roxbury, Mattapan. They're affected by the pandemic, and they're affected by the economic crisis that's happening right now. Having the ability to work a good job at a hotel, having the ability to separate the students so that they're not on top of each other in the dorms, and having the ability to figure out an economic, the economic side, and not being displaced through students, we think is a win-win-win. And I appreciate the council president for raising that. So I just want to be clear, we're absolutely in favor of making sure that the colleges and universities, don't exacerbate the housing crisis, don't exacerbate the pandemic, and don't exacerbate the economic crisis that many of our members are facing, especially with unemployment running out at the end of the month, the extra $600. And this is a creative solution that we are in support of. And one caveat, I know there's some, Councilor Edwards brought this up, our collective bargaining agreements prohibit anyone from a university taking any bargaining unit work. So there's no issue with, an RA cleaning a dorm room. That's just not prohibited. That's prohibited by our collective bargaining agreement. So there'll be good jobs, not just cleaning the common areas, but any other work that would apply to our union. The one, I know this is a long hearing. The one kind of point I'd like to make, and then I'll stop, is, and a couple folks have brought this up, the idea, and this was in the state standards for lodging. I assume, and I hope it's in the university standards that are forthcoming, but there's a line in the lodging hospitality state standard that the governor put out that says, it essentially says limit or prohibit deliveries or outside vendors from coming in. I think it even says visitors. And I know a number of the councils have brought this up. I want to put a kind of heavy line underneath this regulation. If we have folks from Grubhub coming up to those floors at the West End, or we have folks from Grubhub coming in the dorms, if we have different visitors or different vendors coming in and out, say Janitron cleaning, a dorm room, or someone who's not a direct employee of the university, whether it's one of a local 26 member. I don't want to speak for my brothers and sisters on the call here, but we want to make sure we are focused on testing and tracing. We are focused on making sure not a single member of ours gets sick, or another single member in addition has a fatality because of this virus. That all goes out the window. All this testing and tracing, the millions of dollars we're going to spend, that all goes out the window if we allow for Grubhub to come up into these hotel rooms, if we allow for outside vendors to come in. And forget about the economic justice issue. I'm talking about health and safety for everybody. So I want to put a fine line under that. We really, this might be a temporary crisis. These aren't temporary workers. We know who our workers are. We can call them. We have a relationship with them. To your point, Mr. Chairman, if there's not a good testing and tracing model for cafeteria workers, we can be the backstop to that. And if we have folks, coming in, grabbing the food from the cafeteria, and I'm not saying this is happening or being proposed, and bringing it up to dorms that aren't folks that we can trace back, and not a direct employee of the university or college or a subcontractor, that's going to be a huge, huge problem in regards to testing and tracing. So again, I don't see this happening. We don't want it to happen, but it is a fine line. And, like I said, for the hotels as dorms or proposal, it won't be an issue, but I think it's just something we have to keep in mind. We can't have visitors coming in or outside vendors coming in and completely upending all the work that everyone on this call, the administration, everybody has been pushing in regards to testing and tracing, because there's absolutely no way to test and trace if we have a subcontractor who is flipping different employees every day, as we see in both cleaning and both in food delivery. So that's one fine point I want to make. Yeah, happy to answer any questions after the panel. Thank you. And thank you for the opportunity.
Thank you. Jason, the floor is yours.
Hi, yes, thank you very much and good afternoon. I thank you for the opportunity to speak here today, and I'd like to thank Roxana Rivera and Jamie McNeil for their testimony, which I'm going to echo to some degree. So my name is Jason Prentice. I'm a senior lecturer in BU's writing program where I've taught for about 15 years. So my testimony will be fairly BU specific. Recently, while discussing BU's reopening plan with a reporter for the student newspaper, Robert Brown described himself as an optimist. And apparently I'm not an optimist, and I'm not paid to sound like one. I'm one of 102 BU writing program faculty members who endorsed a letter in opposition to BU's opening plan, and one of over 1,000 people who added their names to an online petition demanding changes to that plan. I'm one of 2 people who co-authored a critique of the university's teaching and learning plan for this coming fall, a letter that has been widely circulated and supported throughout the university and beyond. Already, we've heard a lot of reassuring talk from the representatives of Northeastern's administration. Later this afternoon, we'll listen to some more optimistic views from the representatives of the Boston University administration. And as we do, I hope we keep in mind some overarching things. First, what we don't know. COVID-19 is still poorly understood. This past week was one of several that significantly altered our understanding of the disease and raised new questions about it, and that should raise new questions about the university's plans, which were made before these findings were learned. Second, what we know for certain. We know that nationally, the pandemic is out of control. We know that massive outbreaks flare up quickly and that the decisions of a single organization or industry can have terrible consequences for an entire region. We know that misplaced optimism from the beginning of this crisis through the current day has magnified human and economic costs. Finally, we know that the less power a person wields, the more they bear the brunt of these costs. BU's plan for reopening is dangerous. And for what? Representatives of the administration say that students will benefit from the university's Learn from Anywhere plan, LFA, which is similar to NewFlex, I believe. However, as someone who has led successful pedagogical innovations impacting thousands of undergraduates at BU, particularly innovations involving teaching with technology, I'm convinced that LFA is riddled with pedagogical and technological problems. I wish to highlight these problems because they reveal important things about the overall reopening, particularly the administration's misguided, opaque, top-down decision-making and misplaced priorities, which should make us think twice about BU's assurances concerning safety. As LFA was developed, faculty, the institution's experts on teaching, were not consulted. LFA was announced to faculty in bits and pieces, often by articles in the university's public newsletter. Only in late May, when faculty began to protest, did the administration begin to schedule town hall meetings. After the first of these, when I came away with more questions than answers, I asked the dean for a written description of the plan and some scholarship supporting it. This dean was unable to provide this. Such basic information had not been shared even with him. With some of my colleagues, I began researching the hybrid instructional model that BU and Northeastern, it seems, had in mind. A detailed account of our findings is attached to my written statement. For now, I'll summarize. LFA is a teaching model in which the instructor teaches in person and online students at the same time. Even under normal circumstances, without face masks and social distancing, this model poses distinct challenges for both teachers and students. Teachers must split their attention between the students in front of them and those on a Zoom call. Students become frustrated by their inability to hear or participate equally and by delays caused by troubleshooting technology. Contrary to BU advertising, LFA will not result in the rich experience students expect from in-person classes. In fact, because of social distancing, less than a quarter of students may be permitted to attend in person at any given time. For many classes, especially those that rely on active learning, LFA is not better than purely online instruction. It's worse. My critique of LFA, which I wrote with a colleague, was shared with BU's upper administration. In response, an associate provost told us he was optimistic that LFA would work, and he suggested we could get some tips from the university's Center for Teaching and Learning, which was absurd for two reasons. First, because BU Center for Teaching and Learning played no role in the development of LFA. And second, because the Center for Teaching and Learning had already come to me and my co-author for assistance with learning about LFA. Faculty concerns about safety have received similar inattention. How will classrooms be adequately ventilated, especially now that it seems the virus may be transmitted by much smaller aerosolized particles than previously thought? How will social distancing and wearing of masks be enforced? What in the scholarship of adolescent psychology leads administrators to believe that students, ever mindful of public health and communities of caring, will stay in their platoons or families and abide by official exhortations? On a less complex topic, will disinfecting supplies be provided for shared classroom equipment? When a student or instructor tests positive, will the whole class self-isolate for 14 days? If so, who will cover the instructor's classes? These and similar questions have yet to receive serious attention, and there is no track record for meeting challenges of these kinds at this scale. If BU's priorities are not safety or teaching and learning, what are they? Primarily to minimize short-term financial losses by maximizing revenue from tuition. More than anything else, LFA and the larger reopening are means of getting as many tuition dollars from as many students as possible. In emails to faculty, the message from the administration has been that if BU does not reopen as a residential campus with as many faculty and students as possible in person, it will lose huge amounts of revenue and there will be layoffs. From an employee perspective, this boils down to if you don't risk your health or your colleagues' health or your students' health or your partner's health and so on, then you risk losing your job. That's quite a choice. None of us at this meeting should blindly trust Professor Brown's calculus or his priorities, which have been developed behind closed doors and without meaningful faculty, staff, or community input, even though all of us are stakeholders in BU's reopening. That's my testimony. Thank you.
Thank you all. Don't go anywhere. I think we probably do have some questions for folks. Instead of going down the line of counselors, if you do have a question for this panel, please just raise your blue hand. If there's no blue hand, then I'm going to assume you don't have a question, and we'll keep it moving. But in the interest of looking out for the public commenters, I'm just going to give them now. If you're an attendee and you raise your hand, your blue hand, I'm going to give you the floor to speak. You're going to have 2 minutes. Just please state your name. Just let me make sure I get you really quick. Hold on, just so I do this exactly correct. So you're going to have 2 minutes. I'm going to set a timer. Please state your name, your affiliation, your residence, and limit your comments to 2 minutes. I'm going to start with Ian Chandler Campbell. So let me just see. I'm going to hit the allow to talk. Can you hear me, Ian?
Yes, I can. Can you hear me?
Thank you so much. Yes, I can. And so I'm going to give you your time and then two minutes. So please feel free to start now.
All right. Hi, my name's Ian Chandler Campbell, and I've been a member of the Brighton community for 5 years as a doctoral student and an educational and behavioral researcher in Boston University's Wheelock College. I want to thank everyone here for their success in making Boston safer during the pandemic. Today, I want to ask one question. Do we want to jeopardize our progress as a city just because some universities want in-person classes and take over additional housing in the city? Boston University's reopening plan is ill-conceived. BU administrators did not consult disease experts, their own faculty, their own staff, or PhD student staff in making this plan, despite their insistence that this is about pedagogy, which, as a pedagogical researcher, I can tell you this, everything Jason has been saying is completely true. It is an inferior model to online learning. They have prioritized maximizing income and have considered public health as only an afterthought. BU's Learn from Anywhere plan is coercing faculty and PhD students to teach in person under threat of losing their income. They are asking Boston to take in thousands of students from other states without proper safety measures. They have taken housing away from PhD and graduate students in order to set up special quarantine housing, forcing us into dangerous situations. Testing and contact tracing is needed, but is not enough without actual safety precautions to practically prevent the spread of the virus from campus activities. They are refusing to enforce mask wearing or social distancing. They are refusing to provide any access to PPE or supplies to instructors or students. They are refusing to detail how they will ensure proper ventilation in BU classrooms that already exceed state standards for ventilation, according to research from our own Dr. Sarah Beth Buckley. They are also silent on even asking students to observe the 14-day quarantine for out-of-state entrance and or testing on arrival. I teach adolescent development in the fall. Dr. Lawrence Steinberg, the author of the textbook I use, wrote in the New York Times that expecting students to play it safe is a fantasy. This assertion is supported by student-centered outbreaks in other areas of the country. Also, university classes are not a get in, limit your contact with others, and get out affair like many reopened businesses. Our classes are an hour or more in enclosed spaces and require lots of talking. Experts, including Dr. Matthew Fox and Dr. Davidson Hamer at BU, are already saying that a second surge is inevitable, even without an influx of thousands of students. We cannot afford to risk more lives and another shutdown when safe, pedagogically effective alternatives exist. The specifics are not there for precautions, and waiting any longer essentially gives universities a blank check to do whatever they wish before the government acts, and they're offloading even more of the burden onto the city with off-campus students. Thank you.
Thank you so much. Next, let me just thank you so much for that. We next have, let me just make sure I do this right. Timothy LaRock. You are now, should be allowed to talk. Can you speak?
Yeah, can you hear me?
Yep, perfect. Floor is yours.
Great, thank you. And thank you to the council for holding this hearing. My name is Timothy LaRock. I also live in Brighton, and I'm a PhD candidate at the Network Science Institute at Northeastern University. And I'm also a member of the graduate employees of Northeastern University with the UAW, and a member of Northeastern for the Common Good. I'm going to note here as part of my training, I learned how to model the spread of disease through networks of people. So although that's not going to be the main point of my remarks today, my reservations about reopening campus in the fall are heavily influenced by my scientific training, and I feel compelled both as a scientist and as a resident of Boston to speak today. I will highlight two of my many concerns about this reopening plan, and I've also submitted a written public comment with many more details. The first is about input and transparency. Northeastern should have made and should still make an effort to determine what the university community actually feels comfortable with. As far as we know, there was no polling while plans were being developed, and they seem to have been created by senior leadership at the university and college levels, then disseminated downwards, similar to what we heard about at BU. The success of this reopening is highly contingent on buy-in from both students and faculty, the people who are actually going to do the teaching and learning, and sitting here, I do not have the impression that this buy-in exists. Second, I want to point out that Northeastern's proposed hybrid model, NewFlex, is flexible for students, but not so much for instructors. Instructors are expected to work in person and are required to opt out if they need to, potentially meaning they have to reveal personal information about their own health or the health of their family members. Opt-out also discourages low-risk people, quote unquote, people who may feel unsafe teaching in person from even trying to opt out, despite the fact that healthy people can still become very ill and even die from this disease. On top of needing to commute to campus, the hybrid model exposes teachers to a rotating set of students throughout the semester, potentially increasing their risk of being exposed to and infected with COVID-19 at some point. The agency of instructors to decide whether they feel comfortable in the classroom must be respected if this is to work at all. So in closing, I want to lay out what I think should happen. So first, we need to continue to fight the Trump administration to protect our international graduate students from a xenophobic rule announced earlier this week that could result in their deportation if classes go fully online. As a contingency plan, we should ensure that we offer some safe face-to-face classes for students to protect their visa status. With that said, I think Northeastern should move quickly towards an almost fully online model and make in-person teaching opt-in for instructors rather than opt-out. Northeastern has so far chosen to pursue the more difficult, expensive, complicated, and dangerous hybrid model without our input from anyone in the Northeastern community. I don't think it's too late for us to change course, as evidenced by the recent reversal by the University of Southern California, and I hope the Northeastern administration is seriously considering doing so and that the council will help us hold them accountable. Thank you.
Thank you. Kristen Ann Lacey.
Yes, I'm here.
Okay, wonderful. So you now have the floor. Thank you.
Thank you for being here today, everyone. My name is Kristen Lacey. I'm an Alston resident and a PhD candidate in English at Boston University. I am here because I believe that BU's fall 2020 plans are fundamentally unsafe, unethical, and put the greater Boston community at risk of a second COVID-19 outbreak. As a teaching fellow, I am expected to teach students on campus in the fall. If I do not, I may be forced to take a leave of absence with no pay. I am perfectly capable, as my peers are, of teaching a great course online. I will not sacrifice the health of myself, my girlfriend, my students, or the Green Line MBTA drivers and commuters to enter a classroom that is physically unsafe and pedagogically unsound. BU pays lip service to the value of its graduate student workers who teach and mentor their students far beyond the space of a single semester. But their choice to threaten our livelihoods and coerce us into classrooms during a deadly pandemic tells a different story. BU seems to think that anyone outside of the CDC high-risk categories will be fine if they contract COVID. Experience tells us otherwise. The disease is wildly unpredictable and can leave otherwise healthy people with lung damage, kidney damage, strokes, and months-long recoveries. BU must let all instructors decide whether to teach remotely or take this risk by teaching in person. We have been assured also that BU is following CDC guidelines. However, in a conversation with BU parents on June 24th, Assistant Dean of Students Daryl DeLuca said, "Students are going to have pretty much open freedom to engage and participate and socialize with whoever they want." The university is speaking out of both sides of its mouth, assuring undergraduates that they will be given free rein on campus and throughout the city, while assuring the rest of us that we will be safe. I urge this committee to think carefully about the risks BU is taking on behalf of faculty, graduate students, staff, undergraduates, and all Boston residents without our consent. Thank you.
Thank you, Kristen. Sami Kim, are you able to speak?
Yes, can you hear me?
Thank you. Yes, and sorry if I don't know how to pronounce the first name, so hopefully I got that right.
Somi, yeah.
Somi, okay,
Yeah,
wonderful.
thanks.
Thank you, the floor is yours.
Thank you. So my name is Somi Kim. I'm a mother of 2 Boston Public School students, a resident of Mattapan, and a non-tenure track professor in the English department at Northeastern University. Northeastern is compelling me as a faculty member to come back to campus this fall, but I go home to 2 children and a husband who is a Boston Public Schools teacher, and we live in a majority Black neighborhood. Who will be held responsible when I, my family, and neighbors get sick or, God forbid, dies? Who benefits from this plan created by an administration that will have the least contact with COVID-19, and who loses? The faculty, the students, the staff, and the surrounding community. None of us had a say in this plan that sacrifices us in order to go back to business as usual. Furthermore, Northeastern is situated in Roxbury, a majority Black neighborhood that has resisted Northeastern's expanding presence for decades. In a historic time of Black liberation uprising, Northeastern has decided to add insult to injury by bringing students from all over the country and the world to the neighborhood of Roxbury, completely disregarding the research that has shown that COVID-19 is disproportionately impacting Black and Brown communities. Ultimately, the risk of going back is not an individual issue, but a communal one. And yet Northeastern's process for determining which faculty can teach remotely or not is framed as individual. Individual faculty can petition to teach remotely, but this process completely overlooks the nature of pandemics, that viruses spread in community, and therefore compelling anyone back to campus is still contributing to the spread of the virus. Do not be mistaken, I'm not resisting the return to campus because I don't want to go back to the classroom. I do. I love my job and I love my students. But because I love them, because I love my family and my community, I do not want to endanger their lives by contributing to the spread of COVID-19. I'm not simply disappointed by Northeastern's reopening plans, but angry that they deny the gravity of the current situation by designing a reopening plan that puts all of our lives in danger. I'll just close by, I really appreciate the counselors' questions as they reveal that Northeastern will not be able to control the students' behavior, and it also highlights how the level of care necessary to control the spread of the virus will create conditions for more policing in our community, something that we are fighting on the ground currently. We cannot allow these ambitious reopening plans to endanger us. Thank you for your time.
Thank you. If anybody is still seeking to give comment, I see names that are on the signed up list, but there we go. Nicole Corey, is it Corori?
It's Carreri, thank you.
Thank you. And so just really quick before you start speaking, if anybody has not spoken yet and wants to speak and is present at their computer, please put the blue hand up so that I know. Thank you so much. Nicole, the floor is yours.
Thank you. My name is Nicole Carreri, and I'm a teaching fellow and a third-year PhD student at Boston University, and I live in Watertown. I want to thank you for including myself and other student voices in this public health hearing and to hear our concerns about this crisis. I represent one of the many Boston University PhD students who have aligned as a coalition to protest the coercive Boston University policy about the decisions regarding PhD workers and the return to campus this fall. As you may be aware, BU has decided that in order to keep their funding, that's us as students and PhD workers, and health insurance, we have to return to campus by September 1st to teach in person. While undergraduate students have the option to attend class remotely if they do not feel comfortable attending in person, the same consideration has not been granted to staff, faculty, and PhD students who teach. Only those who are high risk by CDC guidelines can apply to be considered for a workplace adjustment, but there is no guarantee that we will receive this adjustment. All others are expected to come back to campus to teach, even if the majority of the students that I work with will be attending class remotely. So today, many of your panelists have spoken about reopening as if it is a given, while erasing the increase in cases across the US of over 3.11 million cases reported today. And also your panelists have failed to consider how many states are rolling back reopening plans at this very moment. Hearing the Northeastern University officials talk about students returning to campus to enjoy themselves with the pleasures of campus life and campus, gatherings when a deadly virus is still an issue is very disturbing. So being forced back on campus makes us vulnerable, and it really contradicts Boston University's own statement that I will quote for you. They say, "Our top priority is to treat every employee with dignity and respect consistent with the values of Boston University." So not only is this disease fatal, but incredibly debilitating for months. And the fact that some of your panelists like Monani of BPDA and the Boston University frame reopening as an economic issue without considering the impact of how this pandemic impacts the Black, Indigenous, and people of color communities demonstrates a lack of commitment to systemic change, which they have also recently announced and committed to. So paying lip service to Black Lives Matter while threatening faculty, teaching assistants, and staff, including janitors, with financial professional devastation if they don't go along with reopening plans is really egregious. I want to remind everyone who's on this panel today, we are still in a pandemic. It is not over. Counselor Bach rightfully described the greatest danger as the influx of students from around the country and potentially overseas to being exposed to COVID, spreading COVID, and then the spread of students outside and beyond university oversight. So there are clear ethical and practical reasons why forcing staff, teaching fellows, and faculty back on campus is wrong and dangerous. This is a public health crisis that universities are now operating like health facilities. COVID-19 is still spreading. Life cannot return to normal. Pedagogy can't return to normal. And while Massachusetts itself has flattened its curve, reopening college campuses will trigger a second wave, even more so than bars and restaurants that have reopened. So in a recent article from a fellow PhD student, Emily Chu, and this is my last point, she quotes immunologist Aaron Bromage, who explains that COVID-19 infection occurs when you're exposed to enough viral particles. Bromage's estimate is that just sitting in a room with an infected person for 50 minutes, which is the typical length of a class, means you can inhale enough viral particles to fall ill. I want to close by saying we are still in a pandemic, and universities should not become policing agencies or be involved in the mechanism of surveillance and health services. Thank you.
Thank you for your testimony. Next, we have Paige Sparks.
Hi, thank you so much.
There you are, and the floor is yours.
My name is Paige Sparks. I'm a Boston resident. I have some grave concerns regarding the current plans for the return of university students to in-person learning. Specifically, I'm concerned about universities requiring teachers to teach with limited exceptions to those deemed high risk, and the influx of students who have been away into the community of Boston. I feel that the nature of college or university life is fundamentally at odds with physical distancing, especially as we see cases rising across the country, coupled with the pending fall flu season. I'd like to take the remainder of my time to highlight the call from BU teachers who have called upon the university to first, out of respect for the autonomy and well-being of the teaching community and their families, not require teachers or otherwise compel them to teach in person, and that all teachers will be afforded the choice to teach entirely online. Second, out of respect for the autonomy and well-being of our student community and their families, no student at any level of the university will be required or otherwise compelled to attend class in person, and all students of the university will be afforded a choice to attend classes entirely online, as may be some universities' policies already. Lastly, out of respect for the privacy of our university community, no teachers or students should be required to disclose their personal medical conditions or those of their family members in order to be permitted to teach or attend classes entirely online. In closing, I'd like to echo some of the sentiments from some of the other folks who have testified today in recognizing that these policies will inevitably impact certain folks more than others, specifically underrepresented and underprivileged populations. Thank you.
Thank you very much, Ms. Sparks. So we have two more before we go back to the panel. Priya Amin.
Hi, can you hear me?
Yes, thank you.
Hi, my name is Priya Amin. I'm an undergraduate student at Northeastern University. I worry that Northeastern's decision to reopen will inevitably result in further spread of COVID-19 and might even result in deaths in the community. Universities all over the country have been faced with massive dropout rates and demands for tuition reduction amid the closures due to the pandemic. And I think that recognizing this, Northeastern decided to reopen with little consideration for its students, faculty, and for the city of Boston. As an effort to safely reopen campus, Northeastern hasn't announced the implementation of a hybrid learning program called NUFlex. However, the details of this program and the reopening in general are vague. Not knowing what to expect leaves students scrambling to fill in the blanks and thus coming up with worst case scenarios. Furthermore, I personally feel annoyed that rather than train professors to effectively teach classes online, Northeastern has wasted their efforts on this new program that might not even be successful. I think Northeastern's efforts would have been much better spent training professors to online teaching strategies that are effective and providing them with tablets, printers, and video cameras to teach from their homes. That being said, myself and several Northeastern students and organizations have created and signed on to the Northeastern Coalition for Affordability, Responsibility, and Equity, also known as NU CARE. Our demands are as follows. For affordability, we've demanded that tuition be reduced for all classes that are impacted by a transition to online or hybrid learning, and refunds must be offered similarly for similarly affected summer classes. This refers to any class that did not previously have sections offered online, but now has sections solely offered online. Both incoming and returning students also must be able to easily defer their enrollment or take a leave of absence for the fall 2020 semester without affecting their education in the spring 2021 semester. For responsibility, students who for any reason do not live on campus during fall 2020 must not lose their housing guarantee. First and second year students should also be released from their obligation to live on campus for the fall 2020 semester, and the housing deadline must be extended past July 15th. The university also has a responsibility to ensure that adequate PPE be available to all students, faculty, and staff, including any contractors or subcontractors. For equity, the university must ensure that any data collected through the NUPD Safe Zone app be used for public health purposes only. Northeastern must be transparent regarding NUPD's role in enforcing social distancing and health measures on campus, as well as explicitly detailing what these are to the entire Northeastern University. And lastly, for equity, Northeastern must be upfront about any plans to lease additional off-campus properties for student housing and work to offset any gentrification caused by this. Thus far, Northeastern has not acknowledged or responded directly to any of the NU CARE demands. However, they did announce during a town hall that Northeastern would not be reduced for the upcoming fall semester. First and second year students have only been given until July 15th to decide whether or not they wish to remain on campus. Should they choose not to, they will not be permitted to attend any classes in person. And if they do not live on campus and attend classes, they will lose their housing guarantee. Northeastern has also announced an advisory board to hold NUPD accountable, but they have stated very little beyond that.
Hello, Priya. Did you, was that your last line?
Yeah, that's it.
All right, thank you. We now have Anid Eckstein. Floor is yours. If you could just speak for me really quick, if you're unmuted. All right. Yeah, there you go.
Okay, sorry. Thank you very much for the opportunity to testify and for the hearing. My name is Enid Eckstein. I'm a Boston resident, and I represent the Pilot Action Group, which is a coalition that, as you know, has advocated for a robust, accountable pilot program. We believe this is a critical moment for the history of our city, and decisions made today will obviously impact the future in many years to come. You've heard a lot of comments about the specific plans. I'm not going to comment on that, but I'd like to highlight some areas of concern for the council going forward. Many people have spoken to the public health needs. As a member, as a resident of Boston and Jamaica Plain resident, it's not enough that the universities have plans for their students and faculty, but as a community member, we need to know what the plans are. They need to be posted, they need to be shared with the community, and there needs to be a requirement from the City Council and Boston Public Health Commission that there's actually dialogue with the surrounding communities of Northeastern, Harvard, et cetera. A second concern that we have is employees. Yes, there's been a lot of discussion about that. I just wanted to raise a couple of issues, given that many of the employees are city residents, and layoffs, furloughs, cuts in pay, et cetera, have really impacted these employees. How do we, as part of the plan, the university should have a plan to ensure that employees actually maintain health insurance and benefits, and that employees who are furloughed, actually there's a plan to return them to work, and what will the institutions do for retraining, et cetera. But I wanted to get to the two other really key areas, which is pilot payments. The city of Boston is already challenged for loss of revenue. Boston relies on pilot payments. It was part of the budget for this year. $49 million was budgeted pilot payments. Last year, full pilot payments would have brought in $56 million, but the institutions only paid a portion of that. While some may have legitimate financial issues, others are doing quite well. Northeastern yesterday announced that they're projected to end the fiscal year with a budget surplus despite shutting down its campus due to the COVID-19 pandemic in March. And that has recently been disclosed in their bond prospectus. So one question we have, are the institutions prepared to pay their pilot, given that they're going to be claiming financial issues? Another key issue to us is community benefits. The Pilot Action Group has long scrutinized the direction and effectiveness of community benefit investment by the city. Today, as other people have testified, communities of color have been disproportionately hurt by the virus. There is much discussion of the need to invest in our communities to ensure a just recovery and deal with the structural inequities of racism. We need these institutions to step up and engage in direct discussions with these community leaders to design the investments that will best serve our communities in the time of crisis. And lastly, COVID-19 exposed structural inequities that threaten the very future of our city. Many of these institutions, despite current shortfalls, have very healthy endowments. Harvard has some 39 billion, BU and BC each have over 2 billion. Each of them have experienced healthy growth throughout the last 10 years in their portfolio. And I would just like to leave you with a quote as you think about your responsibility as city councilors. Quote, "When they look back, these historians will not be asking how carefully institutional endowments were stewarded through these dark economic times. They'll be asking who did something. The endowment will mean nothing if the community around the college collapses. These colleges all boast of their community engagement, but how deep is it? If we are engaged as we claim to be, shouldn't we be asking more than how to save the college? Shouldn't we be asking also how to save our communities? As city councilors, you have an important job here to look at the safety issues, but I believe as you look in the coming months about what reopening means, that there'll be an important role in terms of discussion about what these institutions should be doing to invest in the recovery of our city. Thank you.
Thank you. We have, is that Brian Sousa? I see Brian's MacBook Pro. Is that Brian Sousa?
Yes, can you hear me?
Yes, so just name, affiliation in 2 minutes.
Yep.
Thank you.
Sorry, I've been here the whole time, but I didn't think I would still be here, or I actually had to leave and come back. But I'm Brian Sousa. I live in Somerville. I've been teaching at Boston College for over 12 years, and I've been an adjunct in this area for over 12 years. So I think I'd like to just kind of back up, well, maybe represent Boston College here because I haven't heard that name, but also back up things that my colleagues such as Jason Prentice were saying about major safety concerns. And I think I present possibly a unique perspective because I travel from some semesters up to 3 to 4 colleges, but generally what I do over the last few years is I'm a writer, but I drive from Bentley to BC nearly every day, and I'm on both campus talking to countless students. So I teach multiple classes at both schools, which is great. And as someone else said, I love my job, but I think many of these decisions have been made based only on financial or for financial concerns and not inclusive of faculty, especially part-time faculty, or even asking how we feel, how our families feel, as opposed to, and I should note that Bentley University did do that. They asked every faculty member what they would prefer and the modality they would prefer to teach in. So my comments, I'll try to make it really fast as I finish. And I know this has been a really long time, and thank you guys so much for having this and being here and listening. My comments have to do with BC, but they're very similar concerns to what's been brought up regarding Northeastern and BU. So I feel like the policies are very similar. At BC, we have to have a medical exemption, which has privacy concerns written all over it. We have to, I don't even have a doctor right now, but we have to go to a doctor and get a note, and then they decide if we can possibly teach online, which I think is a violation of privacy and is very unfair to other instructors, perhaps not just myself. The manner in which BC has made this decision is just kind of like, I actually wrote to the Boston Globe about this. It was published last week, has been overwhelmingly non-transparent and stubborn. And I'm concerned about the lasting impact it may have on students, on faculty, on employees, especially. That was what the part that I wrote to Globe about janitorial staff, about bus drivers, about cafeteria workers, et cetera, which I thank you guys for all talking about that earlier. I'm concerned about students traveling from hotspots and the consistency of testing and enforcing that. I'm concerned too that Boston College has not joined other schools such as Harvard, MIT, and Northeastern in suing the federal government regarding non-immigrant visas. I am shocked that BC is requiring the medical exemption that I had mentioned, and that faculty has not been even consulted or concerned in this decision-making process. And then another point I made in my op-ed is just having worked with college students for over 12 years, there is no way that students of this age, if I think back to my classes, in the ventilation in my classrooms, as Jason mentioned, the way that we gather, the way that we converse, the hallways, etc., and the way that college students behave socially in and out of dormitories and cafeterias, etc., there's no way that we can ask them to obey all of this protocol at 18, 17, 18, 19 years old. And especially with the forecast of new waves coming up. I just heard today that they think October, November, December could be some of the worst months of the virus. So just to close really quickly, I find that this decision, especially with BC, it sounds like with BU and Northeastern as well, is really all about money, which is really sad because my job has always been all about the students and not about more money for college that has an penultimate, enormous amount of money going forward. Thank you guys for listening. Appreciate it.
Thank you for your testimony, Brian. Our last comment, public comment, is Mr. Giordano, Richard Giordano. Are you there?
Yes, thank you.
Floor is yours.
All right, thank you. I'm not sure if my video is working. I don't see.
No, it's just the audio.
Okay, very good. My name is Richard Giordano. I work at Fenway Community Development Corporation. I want to thank the City Council for holding this hearing on a very important and difficult subject. And from what everyone else has testified, we really have to get this right. It's a fairly risky proposition, and we're in uncharted territory at this point. I'm not going to repeat any of the salient and good points that people brought up. I just want to look a little bit forward to the real estate implications and the health implications one way or the other of what may or may not happen with the campuses opening. As we all know, and has been commented on by Councilors Janey and Bach, there is a real estate component to this situation that is fairly important to consider. We could either have thousands of students returning to our neighborhood or potentially thousands of students not returning to our neighborhoods all over Boston. Health-wise, there's one set of precautions we need to take on the one side. On the other side, if there are no returning students or many thousands fewer, we have potential real estate losses and destabilization. There are dozens of landlords who supply hundreds of units of apartments to the universities, both through master lease and then, of course, privately. If those landlords at some point in the months or year ahead cannot continue to turn a profit, it's potentially a scenario where they would either go bankrupt or walk away. We have to be cognizant of the fact that there are real estate investment trusts forming right now, waiting for the COVID real estate crash. And so something else to consider as we move forward is the real estate implications of the whole COVID situation. The last thing we need, considering everything we've learned about the housing situation in Boston and what the virus has done, is to have hundreds, if not thousands, of apartments become either vacant and uncontrolled, or bankrupt and foreclosed and flipped by speculators on auction. So the real estate implications are something that we need to be looking at down the line. and how we control that and respond to it. And CDCs in the city throughout the neighborhoods will need to be vigilant. And one of the ways that would help us is if in the university accountability reporting data that the universities turn in every October, if the actual location and addresses of all of the off-campus students could be made public. Not which student lives in what apartment, but simply what buildings and how many beds. Because if we can't track where the students are, public health wise, it will be very difficult to know what's going on. And then real estate wise, it's going to be hard to stay on top of what's happening to landlords who own, in some cases, 4, 5, 6, 800, 1,000 units that are all leased out in one way or another to students. So we need real concrete specific data from the universities on every apartment that every student is in, both for good public health reasons and for, hopefully prevention of real estate problems down the line. I could submit more written testimony later, but I think that sums it up. And I thank you very much for the time.
And with that, we're going to go back to our panelists. Thank you so much for your patience. It's been a long hearing. And so really quickly, I didn't see any blue hands for any questions for Jason Prentice, Roxana Rivera, or Jamie McNeil. Do any of my colleagues have questions for our labor and union folks?
Mr. Chairman, yeah, I just wanted to say, I think I know the hearing's been going on, and I also know that all of our I really appreciated all the information in the presentations from our labor colleagues, and so I just mainly wanted to thank them both for coming and speaking to this aspect today, and also for all the work that they're doing in the trenches, because I just think that I think it is too easy for us to end up, when we talk about universities, talking about an ecosystem of teachers and students. And that really renders invisible just a huge portion of what goes on in these universities and the people who live their lives there, right? Because we all spend much of our lives at work. And so I just really wanted to appreciate everybody coming and thank Roxana and Jamie and Jason. But no immediate questions for me. So thank you, Mr. Chairman.
Thank you, Councilor Flaherty.
Yes, Mr. Chairman, just two things for our some of our labor leaders, obviously with respect to Jamie and Unite Here. Just want to make sure that any of our colleges and universities that are looking to our hotels to bring some relief to their campuses, that they have a seat at the table, and that these institutions are working with the leaders over at Unite Here. And then two, folks at 32 BJ, just want to check with them, particularly with their signatories, as to whether or not they're tracking to see who's tier 3 certified and whether or not they're using the appropriate cleaning materials to clean and sanitize and disinfect.
Mr. Chairman, may I speak?
Yes.
Thank you, Councilor Flaherty. Yeah, we are at the table. Councilor Edwards brought up earlier as well, about room cleaning. And yeah, we are protected. The bargaining units at all the hotels are protected. And, as I was saying earlier, we think it's a win-win-win. It spreads the student body out, right? And so it helps with the public health crisis, which, our workers are also in the cafeterias, so it helps with that. It helps with the economic crisis because we're putting folks back to work. We forget that $600 is running out at the end of the month. Our members, they need to get back to work, and they get to go back to work safely. We're negotiating not only with the universities and their subcontractors, but with the hotels themselves, the safest hotel and cafeteria standards in the country. And it's a little too early to claim victory on that, but I think we can go to the rest of the country and market ourselves as a safe place to come. I will say, the one caveat I had is, we want to make sure that the visitors, to the hotels, and we see a lot of Grubhub and stuff like that. And if there is some sort of app delivery being used by some of the cafeterias in the universities, that it be the direct employees of the subcontractors, the folks that we can trace. We're doing a lot on testing and tracing, and we just can't have folks running in and running out of the hotels, running in and running out of the cafeterias that we don't know, and potentially spreading the virus. So that's the one kind of bright line I want to put on all of this is opening up the hotels we think is great. It deters the housing crisis that we're facing because students aren't taking up the triple deckers and the homes in the neighborhoods that our members live. It helps with the economic crisis because folks can go back to work safely with our guidelines in place, and it helps with the public health crisis and spreading out the student body population. But like I said, we're confident we can reach those agreements, and we do have a seat at the table. So thank you for flagging that.
Thank you, Mr. McNeil. Councilor Flaherty, was that it?
Yes, and then obviously just on the for the 32 BGA, the cleaning side of it is the tracking sort of the tier 3, as well as the materials that the signatories are using.
So of the 5,000 workers that we represent in higher ed, half of them work directly for the institutions, which is Harvard and BC and BU, MIT, and the custodians work directly. So we haven't, it has been frustrating to get a conversation going with specifically BU in regards to just, talking about all the aspects of reopening and the, basically what they're looking at as far as, as they want to increase cleaning and introduce, new chemicals or, so that has been not where, obviously, and I reached out to all the universities where we have workers, whether they're directly or contracted out, just with the institutions, to open a conversation around our recommendations around reopening that obviously include, those cleaning aspects, but also larger ones to stop the spread of the viruses on these campuses. It, again, as I said in my testimony, there hasn't, been the aspect of really wanting to have a forum for that input. And so that has been unfortunate. As far as the other half that are contracted out, I mean, for example, at Tufts University, even though I know Tufts said they did not lay off folks, they actually have laid off the majority of their contracted janitors. Where, we are, talking to those vendors about what the university is asking them to do and how that changes for the workers themselves too, to make sure that what they're asking for, the vendors can actually meet, and also have the appropriate equipment for the workers or protocols in place in training for the workers. So, yeah.
Very good. Thank you.
And with that, before I ask any questions, I just want to make sure any counselor who would like to ask questions, either just raise a hand on camera or raise a blue hand before there we go. Counselor Braden and Counselor Sabi George, is that a hand? No? Okay.
No, I just very briefly want to say thank you so much to the folks who testified from Labour this afternoon. It's very enlightening to hear their side of the story and to get a better understanding. It's been a great conversation, and thank you so much for your participation. Thank you.
And so I just want to thank not just you. I know we have a panel coming behind us, and it's 4:53 p.m. and this started at 1. So I just want to thank them for their patience and their diligence. Same to our folks here from Labor. And I have a question actually for, I'm fairly certain, at least for 2 of the 3, maybe 3 out of the 3, but is it fair to say that the vast majority of your members are people of color, specifically most impacted by COVID-19. Is that fair to say?
Yes.
Yes.
And
No.
No for 509?
No, we're far too monochromatic.
Well, I know for 32BJ and for Unite Here, your membership is, one, they don't get to work remotely, and two, they're the ones most impacted. And so your work and diligence really, really, really matters. I appreciate the work you do, not just for your members, but for our communities. Mr. McNeil is a constituent. And so
District 5.
Yeah, and so I'm well aware of the work that you both do on a local level, not just with your membership. And so I guess my question for folks, and this is for all three of you, and all three of you can answer it. Is there an issue or a question in which you would have liked us to ask you about specifically, or something specifically that you think should be raised as a question that you haven't heard raised as a question that you would like to now answer? And if that's something that you would like, just give me the thumbs up and I'll kick it to you. And if it's not something, then we can do our closing statements from y'all if you want to just say anything before you leave. Anybody have a question that wasn't asked that they'd like to answer?
I mean, what I would just like to say is, I think when you push, if we push a little harder at some of the university's plans for reopening, the plans don't seem as solid as they might initially. And in my testimony, I said something about expectations of students behaving in a way that is conducive towards their own health and towards public health. And I didn't base that on my personal experience, though. I mean, for the record, I teach because I love hanging out with students, and I've been doing this for a while. Anecdotally, I don't have expectations that on Friday or Saturday night, they're going to be thinking about the pandemic. But my point is that we don't have to think about this anecdotally. If we look at scholarship, and the Northeastern administration representatives made a big point about how scientifically based their plan is. If we look at the scholarship, the scholarship of adolescent psychology, or the psychology of young people in the age range of 18 to 22, which is the age range for most of these students returning, it doesn't support that kind of appeal is going to be compelling to them. I mean, their mental development, frankly. And again, we heard some undergraduates speak today, but this is just a general fact, a psychological fact. And so I would encourage the city council. I don't know if you have some researchers working for you, or if you'd like to reach out to some people in academia. I mean, people in my bargaining units, that's kind of what we do for a living, even if it's not our field. But if you push on some of these claims, they're not particularly well-founded. And for example, I don't know about the gold standard test for COVID-19. I mean, I've heard of it, but what does it mean that it's the gold standard? I mean, what does a really, low false positive or false negative rate mean? And when we plug that into the scale of this testing, what does that mean? Because, well, we don't know until we follow through with that. So unfortunately, this is so complex, and the situation is shifting, as I mentioned, sometimes by the week. But that's the only way that we can vet responsibly how practical and responsible these plans are. So that's all that I would like to emphasize. Thank you.
Thank you so much, Mr. Prentice. With that, I don't think that, Ms. McNeil, did you want to answer that, or are you just ready to say closing statements?
No, I think the point I was trying to make, and the point I think Councilor Edwards made earlier, was an important one. In regards to the cleaning of the rooms, I'm always one to get out in front of a fight before it happens, and I think I've made it painfully clear that there will be no RAs taking trash out of private rooms in the Westin Hotel. So we just want to be loud and proud about that. And obviously we welcome the model. It's a great model for the reasons I laid out. But I think it was painfully clear that we have a union. Workers have a union for a reason, and we are excited to get back to work equitably, and safely.
Thank you so much.
Thank you, Chairman.
Thank you. Ms. Rivera, if you have any final things that you'd like to say before we go to the next panel.
No, just thank you for hearing us out today. Thank you.
Thank you so much. And please, I think I speak for probably the entire council. If there are things in which we can help when you're doing the work that you're doing, please don't hesitate to reach out to me, especially anything related to this. But I think I probably speak for the whole council in that sense that we'd love to partner with you in the ways in which you're engaging and protecting your workforce. So thank you so much. And with that, again, you can stay or you can go. Nobody's gonna force you off. But with that, I'd like to turn to our final group, which is Harvard and BU. I know Mr. Hanley there we go, see you now. We also have, so it's Mark Hanley, who's the Director of Government Affairs and Community Relations at Harvard. Ken Ryan, who's the Director of City Relations, Government and Community Affairs at BU. And Claire Ramsbottom, who's the Executive Director of the College of the Fenway Mass Art. And I believe I see two of you on camera. Let me just make sure. That looks about right. I don't see the third. And so with that, I'm just gonna go to Mr. Hanley and then Mr. Ryan to give your opening statements before we open it up to questions or comment.
Thank you, Chairman Arroyo. Can you hear me all right?
Yes, and thank you both again for your patience. I know it's been a very long panel in hearing, so thank you both.
Well, thank you for having us. Appreciate the opportunity to provide the council with an update on Harvard's planning in coordination. I wanted first to thank the lead sponsor, Councilor Breeden, my city councilor, and of course, Councilors Bach and Council President Janey, everyone else who's been able to participate. Thank you. I've got an update on Harvard's planning and coordination for the upcoming fall semester and beyond. Throughout the COVID pandemic, Harvard University has been guided by a consistent and core set of principles. First among them, prioritizing the health and safety of students, faculty, staff, and local residents, and ensuring that Harvard's academic mission, teaching, learning, and research continue at the highest level. In this rapidly changing public health landscape, the universities work closely with the City of Boston, with the state, and with our peer institutions to support decision-making, inform our guidance, and share critical resources. Harvard's undergraduate, graduate, and professional schools have made plans for the upcoming fall semester based on their own unique considerations, and each school's plan is available on the university's COVID-19 landing page, harvard.edu/coronavirus. The majority of Harvard schools this coming semester will take a fully remote approach to teaching for the fall, with some limited examples of hybrid and in-person activities being considered. It was announced on Monday that up to 40% of the Harvard College population, including all first-year undergraduates, will be invited to live in dorms on the Cambridge campus. In addition to these first-year students, Harvard College students who cannot learn successfully from home can apply to live on campus with clear criteria in place to guide that decision-making. Harvard students and residential staff living and working on campus in the fall will take a COVID test every 3 days. And there will be a rigorous program in place to require adherence to safety protocols, rules and guidelines in a social compact. Individuals testing positive or known to have been exposed to the virus will be contacted by healthcare providers from Harvard University Health Services to discuss next steps, including a required isolation period with a dedicated dorm on campus and additional testing. Students will be required to adhere to these protocols in order to reside in the undergraduate dorms in Cambridge. Harvard, similar to many colleges and universities in our region, has partnered with the Broad Institute to access the necessary COVID testing capacity. And efforts have been underway for months to pilot and ramp up a supporting app, Crimson Clear, to help stand up our campus testing capacity. Already today, Harvard employees working on campus can access a baseline viral test, and many categories of Harvard affiliates and employees are required or highly encouraged to participate in the testing protocol. Harvard moved quickly in March to de-densify the campus and transform our teaching, learning, and operations. Instruction moved online, and students who could learn safely and successfully at home were transitioned off campus. Labs and libraries were closed, research was paused, and employees capable of working remotely were asked to do so. The university also made significant accommodations to provide for students who couldn't relocate, travel, or learn remotely, as well as for essential employees who kept core operations at the university functioning. The university established a COVID-19 emergency relief fund to support staff with temporary housing and other essential needs. Harvard also quickly mobilized to provide resources, support, and programs to Boston residents, our community partners, and local nonprofits. A new emergency grant opportunity provided over $100,000 of direct emergency support to 27 nonprofits serving Allston Brighton. We collected and we donated tens of thousands of pieces of personal protective equipment to frontline medical workers. The Kennedy School launched a program, Crisis in Leadership, an initiative to help answer city leaders' urgent call for reliable information on the spread of COVID-19 and equip them with the tools and training to help lead their communities through public health and economic challenges. And Harvard Law School's clinical and pro bono programs continue to offer free legal services to low-income community residents. These are just a few examples, and we've prepared a submission with more information. We've also got more information on our community website, community.harvard.edu. Despite these uncertainties, it's clear that continued collaboration and vigilance will be critical in the weeks and months ahead. I hope that Harvard's demonstrated commitment to both public health and to our academic mission provides confidence in how future challenges will be met. And lastly, I wanted to mention just yesterday morning that Harvard, along with MIT, and I understand now Northeastern, has filed suit to block new federal guidance threatening deportation to international students enrolled in remote college coursework. This is a new rule that was released just hours after Harvard announced on Monday that college courses would take place remotely in the fall. This new guidance, if it's allowed to take effect, would impact about 5,000 of Harvard's international students, nearly 80,000 students in Massachusetts, hundreds of thousands of students across the country. Standing up for these international students who contribute so much to the vibrancy and success of our city and to Harvard's mission of teaching, learning, and research is an urgent priority. I'm happy to answer any questions you have about Harvard's thinking in this fall semester.
Thank you so much, Mr. Hanley. And Mr. Ryan, the floor is yours now.
Mr. Chairman, can you hear me?
Yes.
Yes, thank you, sir. Chairman Arroyo, Council President Janey, Councilors Bach and Braden, thank you very much for the invitation and opportunity to appear before you and the Council's Committee on Public Health for today's hearing. For the record, my name's Ken Ryan. I'm a lifelong resident of South Boston, and I work at Boston University in the Office of Government and Community Affairs. Like our fellow higher education institutions, Boston University, in an unprecedented move reflective of these uncertain times, was forced to shutter its campuses in mid-March to try to help contain the fast-spreading coronavirus. What had been a typical spring semester saw 35,000 students and 4,000 faculty forced to leave campus and quickly adapt to remote learning and daily life without the personal interactions that give a college campus vibrancy and a sense of community. Despite broad-reaching impacts across BU's Charles River, Fenway, and medical campuses, resulting in a $264 million revenue shortfall for our FY21 budget, the historic pivot to remote learning was a critical short-term response to the COVID-19 pandemic, made to protect our communities and neighbors from the virus. By the beginning of April, Boston University launched a targeted and coordinated effort to investigate every aspect of BU's return to campus life, while carefully stress testing every component against public health practices. Working groups overseen by University President Robert A. Brown and Provost Jean Morrison have since been working methodically to develop a reopening blueprint with the primary objective of providing safe and healthy environments for students, faculty, and staff while acknowledging the presence of COVID-19. From undergraduate and graduate studies to research operations to student resident life, each working group has been tasked with determining the actions needed to resume academic, research, and residential programs at Boston's largest university and fourth largest employer. Residential education, in particular, is a core to the mission of Boston University and to the experience of both of our undergraduate and graduate students. Our long-standing commitment to residential education and the in-person engagement of faculty, students, and staff is one of the university's fundamental characteristics. The university's decision to resume on-campus learning and research activities this fall marks the beginning of a new era of academic life, with an overarching goal to make sure that our community members feel comfortable and safe returning to our 3 campuses and resuming daily activities. For Boston University, bringing our communities back to campus hinges on 2 key elements. 1, a testing center that will allow the university to perform its own COVID-19 tests on students, faculty, and staff, and get results quickly to determine if a person needs to be isolated or requires further treatment. 2nd, a strategy BU is calling Learn from Anywhere, or LFA, that will allow students flexibility in choosing whether to take classes in person or remotely. Depending on their circumstances, their preferences, and the course that the coronavirus takes later this year, the hope is that the flexibility in students' ability to choose will go a long way toward making the campus feel safer for everyone. As BU reopens, our actions have been and will continue to be informed by public health guidance and best practices around the coronavirus pandemic. They have been and will continue to also be guided by our long-standing partnership and commitment to the City of Boston. Amid the pandemic, the university has opened its vacant student residence to house employees of the Pine Street Inn, providing a nearby refuge for frontline heroes working around the clock to keep our city's homeless safe. Unused refrigerators on campus have been loaned out to community partners across the city to support food access programs and meal delivery services. Researchers at the National Emerging Infectious Diseases Laboratories have been testing thousands of different drugs for their ability to curb COVID-19 infection. Given the evolving and uncertain nature of this crisis, we recognize that we do not have all the answers at this time. But Boston University is working diligently and continuously towards solutions that will continue to supply our communities and the city with the most up-to-date information possible. We do encourage students, faculty, staff, and our neighboring communities to review all of the information that is available at the university's approach to returning to residential education on our Back to BU website. This site is continuously updated with new information as it becomes available. We have teams of experienced leaders working through the issues that are all of greatest concern to all, including many of those that were raised here today. We know the restoration of normal operations won't come easily or quickly, and at first may not resemble daily life as we knew it just 3 months ago. But we are confident, with everyone's continued and much appreciated patience and commitment to help protect each other, we will get there. With that, I'm happy to take questions, and thank you for the time, Mr. Chairman.
Thank you so much to both of you. And so with that, I'm just going to go right to Councilor Braden.
Thank you. Thank you both for your presentation. I just had a question in regard to BU. We have a significant number of your students live off campus. I think some of the similar concerns that we spoke to Northeastern about in terms of monitoring student activity, control of large parties, and just congregant activities off campus. I know you don't have much control of that, but it really does flag up an issue that we need to discuss. So what are your protocols for educating your students coming back, and how are you going to monitor that?
Thank you very much for the question, Councilor Braden. I actually had a conversation with our Dean of Students Office ahead of this hearing to really talk about this matter in particular. As I stated, we're continuously communicating to our students through the Back to BU website, but we're going to be continuing that kind of education and communication through orientation programs, through start of school communications, and really through formal training of some of our student leaders, our RA staff, kind of our community leaders in terms of the student body. I think it goes without saying that campus life, both on campus and off campus, are going to come with new responsibilities and commitments concerning students' judgment and responsibility to adhere to the new established norms that this coronavirus pandemic has brought upon all of us, not just at the BU community, but our surrounding communities of all of our 3 campuses. We are developing a communications plan for our campus partners and communities to help inform the Dean of Students Office in particular, as well as our Office of Government and Community Affairs, of students both on and off campus that may not be adhering to the guidelines and standards set forth. So I'm hopeful that through that communication strategy, we also have a student-based initiative that is getting off the ground right now to kind of communicate to fellow students, really the necessity to kind of practice social distancing and really take this pandemic serious.
Is there a requirement to wear a mask at all times?
Yes, there is. Yes, as part of our plan, there is a requirement to wear a mask at all times in university buildings, on the BU shuttle. Yes.
My concern is more what happens when they're not on campus.
Understood. And I think that, again, there's going to be a lot of we're going to need to hold folks accountable. Folks are going to have to hold themselves accountable, but I think the community itself holding each other accountable is going to go a long way in kind of against those practices.
Do you have protocols in place for regular testing? Like I just heard Mark Hanley speak about Harvard's plan to test their students pretty regularly.
Yeah, I'm happy to I'm happy to pull up a little bit more information regarding our testing protocol. Just bear with me for 1 second. So right now we do have an in-house COVID testing facility that we are working to get on with nearly 35,000 students and more than 10,000 faculty across 3 campuses. The scale of this testing is going to be very large. Initially, all students and employees will be tested upon re-entry to campus. After that, based on the guidance of public health experts, the frequency of testing will then be determined. The plan is to use a test called RT-PCR tests, which detect both symptomatic and asymptomatic infections. Test results are planned to be delivered to the BU community members by within 24 hours electronically through an app that we're developing for students, and as well as a web portal for faculty and staff. I know folks that talked about capacity, particularly at Northeastern. We have the capacity to do over 5,000 tests a day. And we've also, I think that pretty much answers your question, but I'm happy to add more to it.
Do you have specific protocols for students returning from well-known hotspots like that are really a big concern, that they don't have any controls in other parts of the country? It's just like the wild, crazy West.
So we're obviously keeping, we're doing everything that we can to obviously keep a track of everything that's going on in the world, and particularly the hotspots. Based off of guidance that we would get from the state, we do have, protocols that we would be putting in place. Early arrival dates will be available for students living on campus based on their individual circumstances. Again, all residential students are going to be tested before they are able to move into their dormitory on a regular basis thereafter, at least weekly for surveillance purposes. Same goes for all non-residential students who will be required to be tested prior to accessing any campus facilities, such as classrooms and other community spaces. If Massachusetts has a quarantine order for these specific hotspots, students will need to quarantine upon arrival.
My concern is living in Alston, Brighton, when move-in day is September 1st. It's also election day, and it's going to be pretty bizarre, I think. But my concern is really more of the off-campus students. So many folks will be moving to new accommodation, and it's a big concern of the neighbors in the neighborhood about students coming in who may be asymptomatic carriers of an infection, and unless they're going to be living in student housing, it doesn't sound like we've got a good handle on that before they settle back in the neighborhood.
Understood. And this will be our first summer working with your office. In particular, we have a pretty robust move-in day operation that was obviously in place before the coronavirus pandemic. So we obviously look very much forward to working with you and your chief of staff on that process. In terms of the process for moving onto campus, you know, we're going to be allowing, we're going to be actually requiring students to have a specific move-in date and time using the BU housing portal. Students are not allowed to return to campus without a scheduled assignment for move-in. And once they are coming to campus, we're going to be making sure, obviously, face coverings. We're going to be limiting help to really only one family member or one friend, particularly for the on-campus. But to your point on the off-campus, I think it's really going to be a coordinated effort working with your office and the city of Boston on that.
And in terms of de-densification, like it seems like de-densifying campus actually densifies the neighborhood. So it's a big concern. How are you managing de-densification?
So we do offer, we are offering housing to all of our students. We're unique in that we do offer housing to all, for all 4 years of housing. So we are trying to make it as attractable as possible for students to obviously be on campus. At this time, I can't speak to anything that we're looking to off campus. I know there was a lot of discussion regarding hotels or the leasing of new spaces. If we are in that type of position, we would obviously be utilizing the BPDA protocol that was released today, while also working with our community task force, as well as your office and Councilor Bach's office in particular, to make sure that we're staying ahead of that.
Very good. Thank you.
Thank you very much.
That's all for now. Thank you.
Thank you, Councilor Braden. Councilor Bach.
Thank you. Thank you, Mr. Chairman. Yeah, I wanted to follow up, Ken, on, I mean, I just would definitely echo Councilor Braden's concerns. I really think that given the seriousness of the public health situation with crowding off campus, I mean, it seems to me like BU should be asking everybody who moves back, you know, what's the day that you're moving back, you know, scheduling everyone for a baseline test, regardless of like when they actually, if they're coming back from somewhere other than Boston to start school. It shouldn't be like the students who are living on campus get this baseline test the instant they fly back in, but the students living off campus like live in their apartment and bop around the neighborhoods for a week and don't get tested until like the classes start in the semester. I would worry a lot in terms of handling that initial moment of folks coming back from all over about us treating off-campus and on-campus students differently. I don't know if you can speak to that or
Yeah, I'm sorry if I misspoke. My understanding is that we are going to be testing all, you know, on-campus, all on-campus and off-campus students will be required to have a test again before everything starts this upcoming year. Particularly off-campus students too. They're going to need to again have that test conducted in order for them to even be able to come into a university building, a public space.
Right, I guess, but you see, my concern is often students come back to town a week or two before their sort of formal interaction with the university begins, if they're living off campus. So I just think we need a strategy around how to get those folks tested when they move back into our community and I mean, since you're going to have the testing capacity anyways, right? This is a question of like how you're pushing it out to students. Because I could easily imagine a situation where students like move back and then they're like, oh yeah, I'll have to go, when I go pick up my ID card in a week, I'll also take that test. And then we've got a week without the baseline.
And Counselor, I'm happy to obviously have our housing experts that unfortunately weren't able to join me for this hearing today. We're more than happy to get in touch with your office and Counselor Braden's office to discuss kind of our policies in more detail than I'm able to provide.
Okay, yeah, no, I think that would be great. I would love to talk about that in more specificity. I also just wonder if you could speak to overall, I mean, obviously, you know, you and Mark are here on this panel. Harvard and BU have taken different approaches here, and in the sense of BU having this mixed model where there is going to be teaching in person. And I guess I've been thinking about there are obviously some classes, some types of classes where not being able to teach in person, I think about like science lab classes, right, is kind of a, it's hard to figure out how you're gonna digitize that kind of thing for the people who are away. And I can see the desire to be in person. As an instructor myself, at Mark's institution, you know, while I love teaching my students history and philosophy in person, what we found this spring was it's perfectly like possible to do on Zoom. And so us deciding that a few of us would be in the room together, just sort of for fun, right? That doesn't really clear the bar of necessity that I would think we would want to impose in this public health situation. So I guess I'm wondering what drove the decision to go mixed, and has there been a conversation about the distinction between types of instruction that would really make you want to be in person with all the right protocols versus types of instruction where it might just make more sense and be erring on the side of caution to just keep it all online?
Yeah, absolutely. I mean, I think for us, you know, the flexibility of the LFA design, the Learn from Anywhere, is really to designed to accommodate safety requirements, as well as travel and other challenges that our students are going to be facing this year. The aim is really to present the same academic content to all of our students, whether they're in a classroom or not, or in a BU residence, or really in another country. We feel as if this model also, you know, really speaks to the residential experience that I know you probably heard a lot in my opening remarks about. I think that, you know, between Harvard's model, you know, there were different circumstances between all of our institutions. We're all unique in our different ways. And I think for us, the residential experience is something that we've heard from both our graduate and undergraduate students as something that they really, you know, get excited about with Boston University. So I think this Learn from Anywhere model is what really kind of helps, you know, have that opportunity for both forms of education.
Yeah, I just think, like I said, yeah, I think there's a higher bar for why we would do things in person right now. Certainly we in the city are telling every employer, as you said, right, BU is the fourth largest employer in the city. We're sort of telling every employer the bar for any in-person activity should be that it really can't be done. You know, it can't be done remotely, right? So I find myself wondering about whether we're applying that bar to all of our instruction activities here. I was wondering, Mark, if I could ask you a bit about Harvard Medical School specifically, since that's the branch of that's the branch of Harvard that's in my district, and I mean, there's been a lot of coverage, obviously, of the college, but I was wondering if you could speak a little bit to the plans at HMS.
Of course, Councilor Bach. Harvard has 3 schools, as you know, on the Longwood campus: Harvard Medical School, the Chan School of Public Health, and Harvard School of Dental Medicine. Because of the way that the med school's semester is phased, many of their students go back in June. And so because of that, HMS was actually the first of Harvard schools to announce that they would go remote only in their semester because they had to get the word out before. The dental school of dental medicine, who often co-programs classes, and the Chan School are in the same position. So the fall semester will be fully remote. There are exceptions for some clinical activities that have to be in person, and of course for research lab activities, which have been able to get back to work under some really strict scrutiny and adhering to state guidelines. So there are activities taking place on the med school campus, but in terms of the med school semester, it will happen remotely in the fall.
Mm-hmm. But I mean, don't we have a lot of our 3rd and 4th year medical students are doing rotations? Is that like right in clinical rotations where they would be in person in some hospital somewhere?
Yes. So a lot of that clinical working has to take place in person, but in terms of classroom learning, it's not happening in classrooms. It's happening exclusively online.
But that means that we would expect our medical students to largely, well, I guess here I'm really focusing on the medical students and maybe also the dental students. We would expect them to be in place. Like they're largely going to be, because of that, at least the upper level ones, because of that clinical piece, they're likely to be living in the vicinity of the school this year, right? And so just is, and what's the, I mean, one concern I have is making sure that the attention that the schools focus on undergraduates and their living is also focused on, we often have some younger graduate students in the mix in some of the professional schools for whom we might also need to reinforce public health guidelines. So I just wondered whether HMS, because I know at Harvard sometimes every school is doing its own thing, and whether HMS has a very proactive plan for managing those students' interaction with the neighborhood and their sort of safe housing.
Absolutely. So in terms of the Harvard Med School graduate dormitory, right at the traffic circle there on Louis Pasteur, and in terms of their access to Harvard University housing, the characteristics of that grad student housing, it looks a lot more like rental units. But to get to the core of your question, this concept of a social compact and the requirements to socially distance and the extra efforts that are being made to keep the campus safe, these procedures and policies certainly are extending to the med school campus and to those students who, many of them are going to be in town.
Okay. Yeah. And yeah, just would very much, and sorry, I think I missed this, but with those students as well, like if I guess the medical students and many of them are here over the summer, so they're already, but are you guys, I think I might've missed, are you guys also doing a baseline test with all your students when they arrive?
Many of them are already here, and students living in Harvard University dorms are being tested regularly.
Right. But I guess if I show up and I'm living off campus, do I get a test rate when I arrive or not?
If you are participating in any activities on campus, you will be either required or highly encouraged to take a COVID test, depending on the classification of employee or affiliate. And everyone right now who is doing anything in person, any Harvard affiliate staff is able to get a COVID test.
Mm-hmm. What about actually, and this is a question for you and for Ken, are those testing centers at your respective institutions extending to, I know it's students, faculty, and staff, but what about staff who are subcontractors, who are, so they aren't literally employed by Harvard or by BU?
For BU, Counselor, I would have to circle back. I don't want to misspeak on this, so I'll definitely get you that answer.
Okay, that would be great. And it would also be great to follow up, Ken, just about, I know Roxana made some remarks about just making sure that there's an open line of communication to the janitorial staff in general, right? And with the
Absolutely, I took a tremendous amount of notes. I'll definitely have to go back to the tape for a lot of what was discussed during the public comment, but I will be bringing that back to labor relations and to university leadership.
Yeah, and then I'll also be following up about that question on related to Jason's testimony, just about the necessity point around teaching in person and kind of what the justification on the university side of that is. Mark, did you know the answer on the subcontractor side for Harvard?
Counselor, let me do the same diligence Ken referred to. We have 9 active union agreements, and then of course we have people working on campus in other classifications. I'll get you the correct answer.
Okay, that would be great. So I'm sure I've overrun my time, so I'll stop. I just really want to say, I think we all know this is a moving target, but I'm looking forward in my office to working with all of the universities, and also just recognizing the need for an openness about there may be things that institutions have sort of come out and said we're doing at this point in the summer, and in a few weeks it's just given the situation, given what happens in the country, we need to shift aspects of this plan. So I will just say that I certainly see this hearing as the beginning of a conversation that's going to have to be super iterative and close between the public and the universities, just because of how much things are shifting right now. And frankly, I think also it feels like this is the moment where I'm thinking about this in particular because of hearing the two of you speak about your 2 institutions. this is the moment where there's been a lot of plans made sort of within dean's offices and administrative conversations within each of these institutions. And now they're all coming out into the open. And one of the things we're seeing is that people are doing really different things. They're proposing really different things. And I do think that, I think that as we kind of gut check all those things and put them next to each other, one of the things we're going to need to do is say, oh, maybe this institution actually came up with a better answer here, right? And encourage folks to shift to a more uniform model. And I know I really want to underscore my stress about the fact that I do think that the universities, choose to traditionally have less oversight over off-campus students in various ways. And that that's always been a tension. It's a sort of eternal issue in the neighborhoods, but the public health implications have just really, notched that up several notches. And so we're going to have to really work together on that front. But Mr. Chairman, I'm sorry, and I'll yield the floor.
I considered it revenge for all the budget hearings. So Councilor George, the floor is yours.
Thank you, Mr. Chair, and thank you again to the makers for bringing this topic before the body. I had asked the earlier, one of the earlier panels about support for international students. So if Mark or Ken in particular can talk a little bit about your respective universities in supporting students and squaring away visa situations and making sure that your campus is doing the things it needs to do to support those kids, those young people, not all kids.
Mark, you want to go?
Yeah, thanks, Ken. Councilor Sabi George, our international students have all of a sudden been thrust into an incredibly confusing and tumultuous situation with this new guidance from the federal level. We filed suit yesterday to block that from being implemented. It's an urgent issue, and if the rule is implemented, it's going to cause a lot of issues. Not just at Harvard University, where we have about 5,000 international students. At every school in our city, we're talking almost 100,000 students in Massachusetts. So this is an urgent issue that is suddenly thrust into the legal arena.
And really just to echo Mark's comments as well, our international students play a vital part in our educational community at Boston University, and we're continuing to do everything that we can to ensure that they can continue their studies. We have joined the brief in support of the lawsuit filed by Harvard and MIT in the U.S. District Court in Boston, which speaks to the prohibitive implementation of proposed guidance. And we're working with the Massachusetts Attorney General, who plans to file a lawsuit later this week in U.S. District Court. We're also in direct contact with the Massachusetts delegation to express our concerns about proposed guidance and to support efforts within Congress to urge ICE and the Department of Homeland Security to withdraw the planned policy. One thing about our Learn From Anywhere program, a hybrid teaching model, is that it does justify continuing status. But again, we're very much on record in support of our international students during this difficult time.
Great, and so your model at BU, Ken, does support those kids. Does Harvard have a model available to support those students?
Councilor Sabi George, the vast majority of teaching that's going to take place at Harvard in the fall is going to be exclusively remote. So that's going to be an issue with the new guidance.
Yeah. No, thank you. And thank you both for that and supporting that group of I want to call them young people because they're almost all exclusively younger than me. But I do appreciate that attention that both of your campuses and administrations have taken to support those kids. But also recognizing that those students, whether they're here or home, that we have to make sure whatever either of your campuses look like, that we're able to keep those kids safe and the communities that they interact with also safe. So, realizing and remembering my own sort of behaviors during my college and postgraduate years, there's a real concern around the impact of your student populations on our extended community, and recognizing, especially with Councilor Braden and Councilor Bach, that their respective districts your students are a part of those communities, and therefore our desire for sure is for us to all keep everybody safe. So I appreciate you being here today. I appreciate sort of the complexities of the issues that we're dealing with, and then the sort of larger related issue around this visa piece for your students who are really still our constituents. So making sure that we're supporting them every step of the way and being supportive of that as we work through the challenges that having large populations of younger people in our communities who may not be behaving with great consideration to the contagious aspect of COVID-19. So again, thank you to the chair and the makers for bringing us all together to have this really thoughtful and thorough conversation. Thank you, Mr. Chair.
Thank you, Counselor. And so I have questions that I guess are going to be sort of for both of you. But if I could just, if you could just refresh me on the, you said just a minute ago, you said everything or a specific thing was going to be entirely remote. Mark Hanley, what was that?
Councilor Arroyo, if you look across Harvard University, the majority of teaching is going to take place exclusively online.
Okay. And so is there any, well, we'll get into all that later, but that's helpful for me. Thank you. One of the things that I kind of have a question about specifically, and there's going to be a number of different dorm questions, but when I was in undergrad, most of the folks who I knew who were doing things like work study, being residential advisors, were doing that not because they needed it on a resume, but because they actually needed the benefits that came with that, either the free room and board, or they needed the economic aid. This is going to be an issue if folks open up. The question, one, RAs are going to be at more risk, I would assume, to do the kind of RA duties that they were doing, which was sort of checking on everybody on the floor and opening themselves up to more vulnerability. And in an instance where RAs are likely doing that because they need the actual, it's a matter of need, not so much wants to be an RA as much as it's a need to kind of have the housing or the economic benefit that provides. We're really, I'm not sure what symbol that sends to have them be at risk, but they do need that aid if this opens. And work study is probably going to go in a different direction, right? I'm assuming that if you're opening general common areas and places where people usually do work study, it's either at a much lower capacity if it opens up at all. And so in what ways are both of your institutions sort of thinking around the monetary issues that many folks on your campuses are going to be bringing in, where they were relying on work study, or they were reliant on working a second job that COVID might have shut down, whether they were going to be a waitress or a waiter or something of that nature. There's a number of economic impacts, both within your institutions through the RA work study programs, but also outside, that a lot of your students are going to be dealing with if you bring them back on board, and they won't have that income for books and things of that nature. Do you guys, what is the aid program in terms of specifically for folks like that who might not have qualified for financial aid, but qualified for specific programming? What kind of solutions are y'all looking at for things like that?
Counselor, in terms of Boston University, I think I'm not the expert on that. I would definitely need to get back to you. I can really speak more toward the general financial aid packages that we offer, but I think if we're talking specifically work study, I would like to get back to you exclusively on that.
Okay, that's fair. And then Mr. Hanley, if you know anything about how Harvard's going to approach that.
Yeah. So Councilor Arroyo, those type of opportunities are really important to a large group of Harvard's undergraduate population, especially. Our plan right now is to have up to 40% of our undergraduate college students come back to the campus in Cambridge and live there. So where we're left is that 60% of the Harvard College undergrads aren't going to be living on campus. 55% of Harvard students, Harvard College students, receive financial aid. And students who receive financial aid will receive a $5,000 stipend, basically, if they're learning from home. And that money is meant to cover expenses that are going to naturally, that are going to happen whether they're on campus or not. So there is going to be that extra boost. Amongst our Harvard College students that live in Boston, At last count, we have 138 students. And 65% of those students are actually getting financial aid from Harvard. That was $3.8 million last year. So we do know that we have this group of students who are going to need this extra boost. You'll also be able to take classes over this next summer's summer term. So if they need to spread their course load out, there will be an opportunity to take summer classes, and there will be a reduced rate if they choose to live in the dorms and do that. So we are sort of giving that extra opportunity to those students who receive aid, which is most of the students at Harvard.
And in terms of just, and this is just for it's been a little while, not that long, I'm only 32, but it's been a little while since I was doing my own financial undergrad forms. In what way are you reassessing how much aid is being given for families and folks who are being impacted by COVID-19 and may have been in a situation prior to this where they wouldn't have necessarily been eligible? But, and here's what I mean by that. It's an issue we came up with on it's an issue I struggled with when we were talking about how we deal with folks who have rent issues right now. Because you can have a family that is perfectly solvable in terms of financials, but they're dealing with other folks right now in their family who aren't. They're handling an uncle or an aunt or a cousin or a nephew or a niece. And so they're taking on these added financial burdens that aren't something that you can put on a tax form. And so in terms of how you're working creatively around these kinds of problems where somebody on paper might look like they have the exact same income that they had last year, but in terms of financial responsibilities for their families, for their loved ones, are actually in a deeper hole than they were last year. What ways are you folks kind of considering how to deal with that kind of an issue?
Chairman Arroyo, just to give you kind of an overview of just some of the financial aid stuff that we have, but to get more to your question, 100% of the need of our first year students is met. Our FY21 budget, despite the shortfall that I had discussed earlier, is going to be at $333 million, which is an increase from FY20. 77% of our domestic freshman applicants in particular receive financial aid. We're also going into our fourth year as of FY12 of meeting full financial need without loans for Pell Grant recipients. But I think to specifically answer your question regarding kind of those unforeseen circumstances, we are pooling federal funds that the university received, as well as some reserve funds that the universities have, to really kind of address the issues that I think you're talking about.
Thank you. That's helpful. So just to take it back to just kind of the reopening situation, and I'm going to be perfectly frank and honest about this. When this all started, I think a couple things spurred folks to understand the seriousness of this pandemic, and it was the major sports leagues shutting down, but also it was our universities' quick responses to it. And so I do appreciate that that's kind of how we got here. But one of the reasons in which and why that happened was almost every epidemiologist spoke about college universities as sort of this tinderbox for a pandemic, where you have many people in sharing spaces, in communal spaces. Sharing space, it kind of welcomes a thing like a pandemic in terms of the increase. And so I'm conscious that, and the reason I bring that up is I'm aware. Sorry, my dogs are having a moment. I'm aware that your universities in the past have put student bodies first and have closed and have done the things that they need to do. And so I know that that's where you came from in the past, and I'm assuming that's where you want to be in the future. And so I'm aware that you're looking at different ways in which you want to take care of folks. But I remain skeptical as to whether or not we can do that. And so I'm just going to kind of go through sort of where I see some holes in my own thinking on how this could happen, and just kind of see if you guys have answers for some of those things. I believe both of you are conducting your own tests internally, right? So BU has its own testing going on, and so does Harvard.
Correct.
And so who's conducting those tests?
Councilor Arroyo, I was going to say that Harvard University has partnered with the Broad Institute to create that capacity for testing.
And so who's going to be conducting that? Is that going to be Harvard faculty, or is that going to be a sort of an outside partnership with a hospital? Who's actually going to be administering these tests? Because at a certain level, if it's the hospitals, then that's capacity that we're losing from the hospitals to do this. And so I guess the question is, who is administering these tests?
It's a fair question, Chairman. Again, don't want to misspeak, so I will definitely get back to you just on who exactly is administering that test, so you have that information.
Thank you, I appreciate that. And do you happen to know, Mr. Hanley, who's going to be doing it for Harvard?
Yes, Councilor Arroyo, the Broad Institute, which is a partnership between Harvard University and MIT. They're located in Cambridge. They are a biomedical research organization, and they have been working for months incredibly diligently to create a capacity to process tens and tens of thousands of tests. So they have the lab
work that you're speaking to. So that's the lab work so after the test is taken, it has to go to the lab. Is that the lab capacity that you're talking about?
That's the capacity. And then we've got our Crimson Clear app, and we've got our Harvard University Health capacity to create that feedback loop, whether it requires contact tracing. And the app is going to support contact tracing and also clear communications about the status of the testing.
So I guess my question is more so about the mechanics. I appreciate that, because that's actually, you answered sort of my second question, which was about lab capacity. I know really early in this pandemic, the state had a real lab capacity issue. Basically, we could only get so many results at any given time, no matter what the backlog was. So folks were seeing 9 to 6 day delays on their exams. And so you kind of answered the second part of that. But for the first part, the reason I'm asking is, for Harvard, how many students and how many faculty? So in terms of all of Harvard's campuses and its spaces and properties, what does Harvard believe on a day-to-day basis they're looking at for people who will actually be on these campuses, either working or as students? So what's the number on that? Is it like 4,000, 5,000? How many people do they think they're going to have, give or take, if they're ballparking that with? And I think you said it's what, 45 or 55% of capacity for students?
So, Councilor Arroyo, if we get into the numbers, traditionally speaking, Harvard College has about 6,600 or 6,700 students in any given academic year. Only
on campus?
Everybody, virtually 100% of Harvard College students live on campus in dorms in Cambridge.
Okay, so that's about 6,700 on a regular year. And then in terms of faculty and just folks who make the buildings run, right? The folks who are doing the cleaning, the feeding, all of the different things that are happening in a general day pre-pandemic, would that number put you guys somewhere around 8,000 or 10,000? Do you know where you would be if it included students plus folks who make the buildings run?
Councilor Arroyo, if we talk about the full community of students and affiliates at Harvard University in a normal year, we're talking about 22,000.
And so now what are we talking about with the pandemic and the reopening? What does Harvard imagine that number? What is the number that they're trying to keep that at?
I don't have an exact number for you, but the core group will be up to 40% of the 66 or 6,700 Harvard College students. And then to your point, there will be a whole group of staff and employees who are working to keep operations running and keep the enterprise going on campus. In addition to that, there will be graduate students who are living in graduate housing. But when you mention faculty, one element that we are less exposed to, we're not teaching in classrooms by and large. So the faculty and the folks keeping up the classroom buildings are not going to be exposed in the way that we're discussing.
So I guess is that basically a way of saying that you don't know at this very moment what that number is going to be? Because the reason I'm asking is that's a lot of, when we talk about contract tracing and rapid testing and all of that, it's really important for me to understand. If you say you have the capacity to do, say, 5,000 lab results on any given day, but then you tell me you got about 10,000 people on your campuses, right? All told, with Harvard students and affiliates, then we start to talk about what just the raw numbers of what that looks like are. Does that make sense? And I'm just trying to figure out, because
sense, Counselor.
But maybe if I just tell you the concern, and then you can maybe address the concern and that I'm having.
Can I give you one fact before you go, Counselor?
Absolutely.
They're gonna be doing, as far as I understand, at the Broad Institute, they'll be processing about 50,000 tests a day.
That's good capacity. And so my question, that's good capacity. That's helpful for my thinking. But my issue is this: I think you were here for the Northeastern. I don't want to presuppose that you were actually paying attention.
Oh, I was here.
Okay, so the reality is, one of the things that they had mentioned, I'm assuming you have built in some capacity at BU and Harvard, and I'm going to stop assuming, actually, just have you say yes. But there has to be some capacity for isolation and quarantine, and I'm assuming that you've built that in.
Yep.
Do you know what the number that you have right now in available spaces for isolation and quarantine are? Is it a separate, I'm assuming it's a separate building or a separate space, and not necessarily just, this is a floor for quarantining and self-isolation, and then on floor 3, we have, folks that aren't COVID positive?
Counselor, we have a separate space that's about 250 beds.
Okay, so you have 250 beds, and for BU, what is the space that they put aside for that?
I can get you that figure, Counselor. I can't tell you that the units that we do have are on campus, on our Charles River campus and our Fenway campus. So, but I can get you that figure.
To me on the numbers. So here's why. This is my issue with businesses reopening in general. It's not just the schools. It's an issue I have in general with reopening. When we talk about contract tracing, right, and we talk about what that looks like for, say, a regular person going about their regular business when they're quarantined or isolated. So we're talking about folks, like, for instance, for me, if I can limit my movements in a week, I do. And so we do grocery shopping maybe once a week. We do what we do. There's a very limited contained space there. If you're talking about several thousand people either going to classes or living in proximity to each other, using shared spaces like libraries or cafeterias, when we get to the contact tracing part of that, when we say this person's positive and now I need to find and isolate, how many people can that be? I went to Mass College of Liberal Arts, right? It's little tiny schools, maybe 2,200 people. On any given day, I maybe came into contact with like a third of that school population. And that's being like on the lower end, right? Because we shared the same elevators, we shared the same common spaces, we shared the same library, we were walking within the same class buildings. When it gets to folks showing up COVID positive, what's the plan for rapid reaction to that? And do you have the capacity to, because I don't think the state necessarily has the capacity to do this, and you guys might do this better. But when you have these small spaces, right, these contained spaces, how are you keeping track of your student body population? I know we can't keep track of them when they're off campus, right? I know that there's limitations to that. I'm talking about specifically folks on campus, folks going to classes, folks going to cafeterias, folks going to libraries, folks using and utilizing your campus, which is why I'm assuming they're there. What is the plan for keeping the contact that a student has with another student to a bare minimum, or to a faculty or to a staff member? Because that's my major concern. Is the reality is we're sharing these spaces. And if we're sharing these spaces and this is airborne, or we're talking about doing isolation, it's not just enough that you have the testing and the capacity, it's how quickly can we isolate all of the people who have been in contact with this person before they start to exponentially spread. And so I maybe that was more of a statement than a question, but I'm trying to figure out, for me, that's the biggest issue. And so how are you wrapping your heads around how much contact one student has with, say, entire buildings, entire staff? So for instance, if one student gets sick, how many people in a contact tracing per average is that probably going to be, right? You're talking about a classroom. You're probably talking about a building that they're in. You're talking, what's the goal and the game plan there, and how are you going around that?
So that's definitely going to be a question that I'll have to ask the medical advisory working group that I had mentioned earlier in my remarks.
I appreciate that. But
that's a question. That's a question that's well above my educational level and above my pay grade. So.
No, and I appreciate when folks just tell me I don't have an answer for it.
No, absolutely.
So thank you. And then with Harvard, how are they trying to go about that?
Counselor, I think the best resource that's responsive to your question is the residential community compact guidelines that we're going to require every Harvard College student that lives on campus to abide by. And what it will show you, and it is publicly available, is the level of thought that's been put into how we can confront all of the challenges that you just laid out.
So I'll look at that. I appreciate you pointing me in that direction. I'll look at that. One question about the compact. I believe one of the things that they have to do is they have to actually, if they're going to live on campus, they actually have to sign up for testing. Is that like that's part of the compact? They have to agree to testing? That's for Mr. Hanley. In terms of the compact, do they have to agree to testing? So,
if only if they agree, are they allowed to come back onto campus? It is a requirement of returning.
Okay, and so in order to return to campus, they have to agree to regular testing.
Correct.
And so that includes faculty, I'm assuming.
Faculty will be teaching, Councilor Arroyo, remotely. They're not going to be in classrooms.
What about for support staff? So anybody who's making sure classrooms are running and being cleaned and doing all of that, are they required to sign up for regular testing?
By and large, the answer is yes. We have 9 union contracts, and anyone that is working on campus with those communities that I've been referring to will similarly be required or strongly encouraged to adhere to that testing protocol. And it depends on the individual groups of employees. The answer generally is yes.
And okay, so with that in mind, I guess I have 2 questions based off of that. The first is there a liability waiver in that compact? Is anybody, whether they're an employee, a faculty, faculty you said isn't going to be in the building, right? So for students, anybody who contracts COVID and can trace it to Harvard University in some way, shape, or form, is Harvard University requiring them to waive any liability in which the university itself, or BU for that matter, might be held liable for any actual health concerns or health risks that they've just contracted due to the reopening?
Counselor, in order not to get too far outside my wheelhouse, I'm going to send you the document.
Fantastic. And if you don't know how to do that, just Ricardo Arroyo at boston.gov will send it directly to me, and I'll send it to the rest of the council.
Thank you.
Counselor, on that specific question about the liability waiver, no, the university will not be requiring liability waiver.
Okay, and are you requiring similarly to Harvard? Is there some kind of compact that's going to be done about mandatory testing?
By and large, yeah, I can get you definitely more details on that, but we are again requiring students to test before coming onto campus. We will be asking faculty and employees obviously to be testing as well. But I can definitely get you a more concrete answer.
I appreciate that. Thank you so much. And I know I'm not trying to put anybody on the spot. It's just these are, when we're talking about these issues, we are talking about life and death issues in a very different way. And so I'm just trying to make sure that anything that for me is the questionable thing, that I'm just putting it on the table, because at a minimum, I want y'all to hear it and bring it back and deal with it in however you all deal with it. And so I think we're nearing pretty much the end of that. The one question that I have for both of you is, how open are your public spaces? In other words, if there's a library or a cafeteria, are you managing capacity? And I'm assuming the answer is yes to that, but what is the capacity levels that you're going to be looking at? Or is that going to be in fluctuation with whatever's happening at the state level?
Counselor, I'm looking at a page from our Back to BU plan that kind of breaks down a lot of the traditional spaces that we have, libraries, common areas included. I think it does obviously depend on the type of space we are talking about, but to your point, there are going to be limits. There is going to need to be 6 feet. Those aren't going to be negotiable. So, I think it does depend on the space, but when we're talking about dining halls, libraries, any type of spot where, folks are kind of convening or would normally convene, those are all going to have limitations and social distancing requirements.
And then I guess the other question is, in terms of, the requirement, at least for Harvard, I don't know yet whether or not BU has the same. I'm assuming, let me just ask you this before I ask Mark. Mr. Ryan, does BU require, just like Harvard will eventually, that folks that are working as affiliates or in staff positions be tested mandatorily in order to work?
That again, I would have to get back to you, Counselor. I don't want to misspeak on that.
Okay, so here's why I ask. One of my questions for this is, the reality is most of your essential staff looks like me. They're going to be Black, they're going to be brown, and they're going to be more likely than not to have disparate outcomes for contracting COVID-19, or frankly, I mean, it's borne out throughout the country. And so the question I have for you is, and this will be my final question, to be honest, on this. If a worker says, you know, I can't put myself in this situation, I can't actually be at risk, what is the, at that point, is it essentially, are we laying them off? Are we suspending them? Are we firing them? What are we doing in terms of Harvard and BU's response to essential employees who just can't afford the risk? They have actual health risks or health concerns or age concerns regarding the fact that we are in a state of emergency, a national emergency with a pandemic. And what is your obligation to those workers if they're unable to come in?
Counselor, I can tell you that we do have a workplace adjustment request policy in place that applies to faculty and staff. I'd be happy to get you more particulars on that, just so you have the full-fledged details on how that process works. It's an HR issue, but like I said, I'm happy to get back to you.
And again, this is, you know, not to put y'all on the spot, you're trying to open up. But this is an
Again,
issue
these are incredibly complex issues.
We're working with it at City Hall, right?
Yep.
So it's the same kind of idea of how do we handle that. I have my own staff. It's not nearly as large. Same conversations that we're having, right? I wouldn't want to put my workforce in that situation, and so I don't. And so in terms of your workforce, it's much larger, and trying to ensure that there's some kind of obligation where folks aren't being penalized in some way, shape, or form for real risks and health concerns during a global pandemic. So with Harvard, how is Harvard working with that? And if you don't have that information and you want to send it to me offline, that's fine too.
Counselor, what I can tell you definitively is that we have pathways for those issues to be raised because they are so important. So to the degree that that pathway might be a little different, depending on the category of employee and depending on the contract, it might be an HR issue. It might be an Office of Labor Relations issue. It's a workplace safety issue, and it's something that we got to raise up and talk about. My ability to get more specific, the more specifics you give me, the more I can give you, and I will have to get back to you with some of the detail.
Just to be super specific on what I'm talking about, cafeteria staff, janitorial staff, security staff, if they're in contact with your students, then they're also at risk of either contracting COVID or transmitting COVID.
Mm-hmm.
And if the requirement for your students is that they have to sign a compact to be in that space, right? Mm-hmm. And they're essentially, there is a way for them, I'm assuming, to, if they don't want to do that, be remote. I'm assuming that there's an
absolutely, yes. If they don't agree, they can't be there.
Security, your janitorial staff, your cafeteria staff, they don't have the option to be remote. You can't remotely clean a room. And so if they're in a position where they are actually a elevated health risk, is there and so they're willing to be, say, tested, but they're not willing to take on, with good reason, these health risks, what is the opt-out that Harvard is giving them or BU and this is just specifically, you can take this back, you don't have to answer now. What is the opt-out that Harvard or BU is giving them that doesn't involve being fired or laid off or suspended, right? Because if you're willing to say to a student, I understand that there is an elevated health risk, I understand why you don't want to be here and you can be here remotely, or to your professors or whoever, that's not something that your lower on the socioeconomic scale, much more essential staff has the ability to do. And so my question here is really, when we're talking about protecting them, specifically, not just from COVID, but also, the reality is if you didn't open, you would have had to work something out. And I think in some cases you actually have. I'm not all the way up to speed on all of the things that have happened in the past, but I think there actually have been agreements and things that have been done. And so I'm not really pressing you on that. But the question is, if you reopen, what are the standards and what are the ways in which you're allowing folks to opt out of having to work on site without having to opt out of being employed? that's basically the question, right? And that's for your essential workers, most of whom look like me, most of them who are coming back to our communities and communities that have already been ravaged, frankly, by COVID-19 and will continue to be. And so that might be something you don't have the answers for right now, but I wanted to make it kind of specific what I'm talking about, so that hopefully when you come back, you can give me like some answer. And the answer might not be to my satisfaction, but I just want with some kind of answer on that.
We appreciate the specificity, Mr. Chairman, and like I said, it helps us go get back the answer for you.
I appreciate that.
Thanks, Counselor.
And so I think that's it for me right now. I just want to thank you both again. I mean, it's 6:09, so thank you again for being here and being thorough. And I do want to make sure that I commend both of your institutions for really early in this pandemic, really striking home really tough decisions. I know that both universities, I think every university we've had has paid sort of a price for having to sort of bear the weight of some of the things that our pandemic is forcing them to do. And unfortunately, where I think we are right now is weighing whether or not there's an economic risk to a health risk to a safety risk to how do we try and make all of these things work. And just the fact of the matter is the mission statements of your universities are to educate and to create future leaders. And how do we keep doing what your mission statement is in these situations? And so I appreciate that you're working through these problems, you're struggling through these problems just like every other base is, with the differences, my workforce doesn't live with me. And so in terms of your students, they live on campus, you have a responsibility to their safety and health in a different way. And so just thank you both for being here. And I look forward to we'll follow up in a week if I don't hear from y'all, but I'm hoping we do get that information in. And with that, I see Councilor Braden, who is the lead sponsor on this, is still here. And so if you have any closing remarks before I allow both you, Mr. Ryan, and you, Mr. Hanley, closing remarks. And again, deeply grateful for you being here for this time and have these questions asked and to be responsive to them. I appreciate that you're trying your best under difficult circumstances. So Councilor Braden.
Thank you, Chair Arroyo, and thank you, Mark and Ken, for sticking with us. This has been a very long hearing, but a very valuable and important discussion. And thank you so much for your contribution. Many questions have been answered and many more questions have arisen in the course of our conversation. I feel it's really important as we go forward that we keep all communication open and that we continue to work together and problem solve and find our way through this labyrinth that we're in. There's so many unanswered questions on a global scale about this pandemic, but I feel really blessed and proud to live in Boston, where I feel that we have a lot of work to do, but that there's a very concerted effort to try and work together and address these issues. And thank you so much for coming today. It's been a long afternoon and I really appreciate your participation. Thank you.
Thanks, Councilor.
Thank you so much. And I just saw Councilor Bach is still here. Councilor Bach, if you would like to chime in before we let these folks go up from our 5-hour here.
Thank you, Mr. Chairman. I already made my closing remarks. I'll just thank you for chairing such a marathon here and everybody who participated. And like I said before, this is going to be very much an ongoing conversation, even beyond the 5 hours that we just had. So thank you again, and thanks to all.
Thank you. And then just one last question, just for my own. I know the city has apparently not been really brought to the table so in a formal way. They've had informal conversations with the state as the state's setting up their guidelines. Is Harvard or BU at all involved with the conversations that the state is having in terms of the guidelines for reopening? In a formal way, not necessarily whether or not they've been called, but whether or not they're involved in any formal way with those guidelines or how they're being put together.
I could say that our office has obviously been tracking, tracking everything that has been going on the state and city level. I can't necessarily speak to direct conversations with state officials, but I'm happy to, again.
No private information in that sense, but just whether or not you've been, I'm assuming that you have more expertise in terms of what your faculties and what your students and what day-to-day life on a college campus looks like than necessarily state officials do. And so whether or not anybody's tapped into either one of your universities to kind of just get a sense or a lay of the land of what you expect to be major issues or what you are trying to actually plan around.
I can definitely say that we definitely had healthy conversations with the city, with the state, pertaining to what we're doing. There is that constant line of communication that I think is going to be imperative moving forward as well.
I appreciate that. That's actually exactly what I was trying to figure out, if you were at the table in any way in that shape. And I'm assuming same with Harvard.
Yeah, Counselor, I know there's been major interactions with the Governor's Reopening Advisory Board.
Yeah.
And I know that's been one of the conduits for the city and the state to interact about the phased program and the phased approach to get back to work here and to think about what the safest way to do it is. So we've certainly been involved in that, in the really excellent outcome of allowing on-campus research to resume around that May 18th milestone. On-campus research in Massachusetts and research generally is a $6 billion section of the economy. These are activities that happen in clean lab situations. So in terms of getting your bang for your buck on what's the safest activity that also takes up a huge portion of the economy and puts tens and tens of thousands of people to work, and also uses a lot of federal money, billions of dollars of federal money, on-campus research was a win for everyone. So that's been one of the earlier elements of higher ed's interaction with both the state and the city. And as we look at future phases, we're hoping to achieve that level of success for sure.
And Mr. Chairman, I'd be remiss if I didn't point out too that our President Robert Brown is part of the higher education working group that the state has formed. I know that Lori Leshin, president of WPI, is leading that group. So he has been obviously in touch with her on a number of different things pertaining to the state's involvement in reopening plans, and does in fact sit on the mayor's reopening task force as well. So just to give you that context of our involvement with both city and state.
Fantastic. I appreciate that. I think we do better in partnership and when we're not siloed. So I just want to make sure that it wasn't folks working in vacuums or not necessarily having conversations. So that's fantastic. And again, thank you to both of you. And thank you to your faculties. I know you've both had faculties that have really stepped up during the pandemic on a national stage in different ways. I've certainly spoken with many a Harvard epidemiologist. BU has also had some really impressive faculty in terms of stepping up onto this crisis. And so I think that's a credit to your institutions. And so I want you to make sure that you bring that back. I'm sure they're not necessarily watching up to hour 5 to bring that back, but please do thank your folks who are responsible for both their hiring and their work. And so thank you so much. And thank your faculties for me and the folks on your administrative side who've been really working on these issues. And again, thank you, Harvard, for really lifting up the fight against ICE on what they're trying to do to our foreign exchange students, and BU for your support on that. So thank you, both of you, for that. And if you have anything final that you'd like to say, I'm happy to release to everybody.
Nothing further from me, Mr. Chairman. I have some homework to do. I'll obviously be back in touch with your office and the other counselors with specific answers to questions, and looking forward to the continued dialogue.
Thank you so much. I mean, it's July 9th, so we got a lot of work to do. These are questions we have about BPS. These are questions we have about a whole bunch of different situations that we're walking into. So thank you both of you again for your transparency and for making sure that you're doing the best you can be to be responsive. Deeply appreciate it. And with that, I'm going to adjourn this meeting. So thank you again to the advocates and to you all on the panels who've been here. Thank you. And I see you, Roxana. So thank you, Ms. Rivera from SEIU 32BJ.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman.
Thank you.
That must be some record, is it?
I think the budget meetings we're doing.
I was going to say it's competitive, but not a record.
Yeah, yeah, but not a record. I think we need like another hour or two, which I'm not willing to put in. So thank you all. Meeting adjourned.
Thank you.
Bye.
Thank you.
Bye now. Thank you.